Welcome, everybody, joining us on webinar 245. Since the since we started on May 2020, it has been 4 years of these webinars. Today, we're pleased to introduce the webinar Impact of Pregnancy in Teenagers of Latin America and the Caribbean, Challenges and Progress. In 971, with the generation of this agreement, all of the countries in this continent joined together in order to create a bridge for peace, and we wanted to work for the benefits of all of our population. Nowadays, the Andean Organism of Health, Hipólito Unanue, has a trajectory of unity and is constantly working with the health ministry on the 6 countries in order to improve health rights. COVID-19 pandemic reaffirmed relevance on the health sector for life, and therefore this is a priority to keep health in the center of our policies. And social awareness in order to have a common wealth and move forward in a society. So health is bridge for integration and for peace. The strategic plan on integration health 23 to 2030 of ORAS CONU says that to make sure that we have health and social justice and environmental justice, it is key to work in strengthening the health system by emphasizing primary care. Such reflections and summary of these actions could be found in the Notisalud bulletin. We would like you to see if this is that's something that you could find in the integration set. So we would like to mention that you need to get the YouTube Live, and you could leave this question here or send it to us through the email or the webinar. It could be through Gmail. So we need to go into a fixed link, and this is where we need to get a previous survey to fill all of the corresponding data. So we are going to be sending you through this road. Now, this webinar is a must today.
Reconocido por los ministros de salud del área andina como un problema de salud pública y que se trabaja desde el 2007 desde el Organismo Andino de Salud. Este webinar se realiza en el marco de la Semana Andina y Centroamericana que los países celebramos desde el 2010 como una iniciativa del ORASCON.
There's an initiative that we have from ORASCONU, and now we will have a dynamic. We will start with the institutional wording words and the conferences in order to have a dialogue with the questions that all the participants are going to ask through the chat box. So now we would like you to leave your comments as fast as possible so we can process them. In order to start with this journey, we're going to have Dr. Mari Carmen Tavila. She's the Executive Secretary from Hipólito Unanue. She's going to greet you and provide the opening words. So good morning, good afternoon, or good evening, depending on the occasion you are at for the Andean organism. It's of relevance, and actually this is quite relevant for me because I'm a pediatric and I work with adolescents and young people, and I know that the phase of adolescence
y crucial para el
should be
desarrollo del
quite
ser
relevant
humano.
and crucial for the
Durante este
human being
periodo de la vida
development.
se presentan
Throughout this
cambios
period of life, we
fisiológicos
have
en el nivel
biological
óseo
changes.
correlando a la
Among
aparición de
those, we
etapas
have
de
hormonal
reproducción,
changes and
así como
reproduction
también
capacity as
cambios
well. We also
cognitivos,
have cognitive
emocionales
changes,
y
emotional,
sociales.
social
Es una
changes.
etapa en la que se
This
presentan
is
grandes
a phase where
oportunidades
we have
para construir y
opportunities.
consolidar formas de vida saludables, en la cual se aprende a ejercer derechos, pero también a asumir
We
y
learn
compartir
how to
responsabilidades.
undertake rights
Por
and
esta
share
razón, en
opportunities.
este proceso,
This is
los
why
adolescentes necesitan apoyo y
we
acceso a
need
información
um,
oportuna y de calidad
access to
que les
timely
permita
of
tomar
information
decisiones que
that
prevengan
would enable
determinadas
to take
conductas que
decisions.
pueden generar riesgos para su salud. Sin embargo, todos sabemos que existen obstáculos para los adolescentes
We
y
know that there's
jóvenes
obstacles
que
for
quieren tener
adolescents and young
acceso a
people that
información
would
sobre
like
su
to
salud
have
sexual y
information on
reproductiva.
sexual and reproductive
En los
rights.
países andinos, el
In
embarazo en
Andean
adolescentes
countries,
está influenciado por diversos
teenage pregnancy
factores
is
como la
influenced by
pobreza,
several
la
factors
falta de
like
acceso a
poverty,
educación sexual integral, la barrera de acceso a información y servicios, incluyendo el acceso a anticonceptivos.
access to
Se tiene
contraceptive,
un
for
10% de
example,
las adolescentes entre 15 y 19 años que son madres, existiendo grandes diferencias entre regiones y al interior de los
because there is
países.
large
En
differences
las
among
áreas
the
urbanas,
regions.
el 9.1% de las adolescentes son madres, mientras que en las áreas rurales este porcentaje
And the
se
rural
incrementa.
areas, this
Por esta
percentage will be
razón, desde el
increased.
2007, los ministros de salud reconocen el embarazo no deseado en adolescentes como un problema de salud pública, pero también lo reconocemos como un problema de derechos
And
humanos,
sometimes we
como
can
un
acknowledge
problema
this
de
as a human right
desarrollo y un
problem,
problema de
as
sostenibilidad.
an
Para
inequality
hacer frente a
problem
esta
as well.
problemática, se requiere un compromiso firme y
And we
sostenido
require a
de
firm
todos los
and
actores
sustained
involucrados para eliminar las
aspects.
barreras que influyen en que niñas mujeres no accedan a servicios. Con el objetivo de intercambiar, conocer sobre la situación, avances y desafíos, tenemos el gusto de contar con tres expertos de un palacro. Damos la bienvenida a Alejandra Corao, ¿no? Nuestra asesora regional en salud sexual y reproductiva, a Edgar Navas, nuestro asesor regional, un palacro en todo lo que es insumos, y a Carlos
We have
Gutiérrez,
an advisor in
nuestro
everything
especialista
regarding
en
raw material. We
comunicación
have Carlos
y
Gutierrez, our
de
specialist.
movilización de recursos también de un palacro. Tuvimos la suerte con Gloria de estar en Santo Domingo hace 2 semanas en una reunión regional muy importante que hablaba acerca de la aceleración, acelerar la reducción del embarazo en adolescentes en poblaciones más
We need to
vulnerables.
speed up
Así que
the
bienvenidos, bienvenidas. Estoy
the
segura que va a ser un
solutions for vulnerable
excelente
population.
webinar
And I'm sure
y
that this is going to be an excellent
muchísimas gracias por su
webinar. And
atención.
thank you for being here.
Muchísimas gracias, querida doctora Calle.
Thank you,
Bueno,
Doctora
luego del
Cayo.
saludo de nuestra secretaria, me presento.
After the greeting
Me
from
nombre
our,
Gloria Lagos Eizaguirre, yo soy gerente de cooperación
I am a
internacional
manager of
y
international
facilitadora de la
cooperation,
Comunidad
and
Interinsular de
I am a
Adolescentes
coordinator
en el
of
Programa de
health
Salud
for
Pública de Lima.
adolescents
Hoy tengo
in
mucho gusto
Hipólito
de
Unanue.
hacer la
So I
moderadora
will
de
be
este webinar.
moderating this
Sin
webinar
más
today.
intereses, vamos a continuar o
So
vamos a dar inicio al mismo,
we would
como
start
presentando y
by
dándole la más cordial
introducing or
bienvenida a nuestra
greeting
querida doctora
our
Alejandra Corao.
Dr. Alejandra
Ella
Corao.
es médico
She
licenciada
is a
y graduada en
physician with
medicina del
a
adolescente.
postgraduate
Es
degree in
asesora
pediatric
regional
and a
de
master's
salud
in
sexual y
teenaging
reproductiva en
medicine.
Colombia.
She's technical
Conoce las
advisor
barreras
in
del
sexual and
embarazo en ese
reproductive
entorno.
rights in
Es
UNFA LACRO.
asesora
She
de salud
started
sexual y
her work
reproductiva
in the
y
United
recientemente
Nations in
del Fondo Comunitario
2003
de Naciones
as
Unidas para la
a
Niñez,
sexual counselor
donde
in
coordinó y
the
gestionó el programa de salud
UNFAP in Venezuela. She coordinated and managed the Sexual and Reproductive Right Program. In 2012, she received the position of director in ONUCIDA. She led the coordination on interinstitutional and national response when it comes to HIV. In 2015, Dr. Corao was part of the ONUCIDA regional support team for Latin America and the Caribbean as a main advisor of a regional program. Dr. Corao has over 21 years of work experience in public health, focusing on sexual and reproductive rights. Go ahead, Alejandra.
Muchísimas gracias, Gloria. Muchísimas gracias, doctora Mari Carmen Calle, por sus palabras. Como ya se dieron cuenta, compartimos pasión por la salud y el desarrollo de los adolescentes. Voy a compartir mi pantalla. Por favor, me confirman que la pueden ver correctamente.
Sí,
Can you see my screen?
Perfecto. Bueno, me corresponde en los próximos 20 minutos conversar sobre qué sabemos del embarazo adolescente en la
We need
región
to
de
tell
América.
you a little bit about what
Y
we know
vamos a
about teenage
enfocarnos
pregnancy
en
in
estos
Latin
7
America. We're going to
pilares que
focus in the
están
7
mostrando
pillars.
7 hermosos rostros de
These
nuestras
are
niñas y
7 beautiful
adolescentes en la región.
faces.
Lo primero que todos sabemos es que la
The
tasa
first
de
thing that we
infecta
know
de
is that
adolescentes entre 15 y
the
19 años y en menores de
TEFA
15 años
between
es la
10 and
segunda
14
más
and 15 and
grande
19
de todas las
is
tasas
the
a nivel
second
global,
biggest one in
solo
all the rates.
superadas por el África
And this
sahariana,
is
países
only
con
been
desarrollo económico
lower
mucho
than
menos
sub-Saharan
privilegiado que el de
Africa.
la región de América
So
Latina y el Caribe, cuentan
these
con
are
una
areas that are
tasa de embarazo
underprivileged,
adolescente
and
mucho
we
mejor
have
que nuestra región.
status of
Sabemos
teenage
también
pregnancies that are way
que
better than our region.
la
We
tasa
also know
de
that the
adolescentes entre
TEFA
15 y 19 años es
between
la que ha
15 and
disminuido
19
más
years
lento
has
de
decreased
todas las regiones
slowly
desde que se
in
firmó
the
la
regions
Conferencia
since we
Sectorial de Países en
started
Desarrollo en 1994.
checking
Como se pueden dar cuenta, en todas las otras regiones el descenso ha sido mucho
this
mayor
work
que en la
since
región de
1994.
América
So we
Latina.
know that the
¿De qué
decrease has been
estamos
way
hablando?
larger than what
Estamos
happened in
hablando
Latin
de
America. So we're talking
1.636.500
about
menores de 19
1,636
años al
births
año
for
en el
women
mundo.
minor that are
36.000
minor
de
than
ellos
19 years.
corresponden a niñas y menores de
36,000 of
15 años.
those are
Yo saqué las
coming
cuentas.
from
Eso implica
young
que un
women
adolescente entre 15 y
younger than
19
14
años,
years. So this means that
3 de
adolescents
ellas son
between
madres de
15
cada
and 19
año
years,
en
we
nuestra
have
región.
3 that are mothers
Y
in
si nos
each
vamos
minute
a las
in
menores
our
de
region.
15 años,
But if we talk
4 niñas
about the
menores de 15
women
años
that are
son
less than
madres
14
cada
years,
hora en nuestra
4
región. Es
are
decir, que cuando
mothers
terminemos este
each
webinar,
hour in our region. So that means
12
that once we finish
adolescentes
this
habrán
webinar,
sido
12
madres
adolescents are going to
y
be mothers,
8
and
habrán sido madres
8
menores
of
de
them
15
would
años.
be young
Esto
mothers,
además
minor than
refleja
15
profundas
years old. So
desigualdades.
this reflects
Refleja profundas desigualdades tanto
large
dentro como
inequalities
fuera de los
inside
países.
and
Como
outside of
pueden
the
ver, todos
countries.
aquellos
As
países
you
que
may
dibujamos
know,
a la
all
izquierda de este
countries
gráfico
in red
responden a
to the
países
left of
que
this
tienen una
chart
tasa
are
específica de
countries that
efectividad
have
mayor a la
a
media
fertility
regional
rate that are
y todo lo
higher
que está en
than
amarillo y
the
rojo es porque tiene una
average
tasa específica de
in the region.
fertilidad
What we
adolescente
have in
mayor
red, we have a
que la
specific
medición global.
rate which
Es
is
decir, que no
greater than
solamente
the
estamos mal como
global
región, sino que
rate.
dentro de
So
nuestra
this means that
región, en esta
not only we're
fotografía,
having
vemos
problems at our
países
region,
que
but in our
todavía tienen
region,
mayores
we're
retos.
seeing countries that still
Este
have
gráfico me
lots of
pareció muy
challenges.
interesante compartir,
This chart is
porque además
really
nos refleja
interesting
muy bien
because,
que a
in
pesar de que
addition,
la
we
región,
know that in
como
spite of the
región
fact
América Latina,
that
ha tenido un
Latin
impacto
America
bastante
has had
bueno en
a
garantizar el
great
derecho de las
impact in
mujeres adultas a tener el
guaranteeing
número de hijos que
adult
quieren,
women
no
when
ha
having
ocurrido lo mismo con
the
la tasa
amount
específica
of
de
children
fertilidad
they wanted.
adolescente.
The same
Por
thing did
ejemplo,
not
ustedes ven aquí una
happen
región como
with the
Asia,
fertility
¿verdad?
global rate. For
Donde
example, in
vemos que más
Asia,
o menos las
we could
mujeres tienen en
see
promedio
that women
1.8 hijos al
approximately have
transitar los 12 vida,
1.8
que es la
throughout
baja
all of their
tasa de
life,
fertilidad global, y tienen una tasa
1.80
específica
children.
de fecundidad
And
in
we
vitro
have a
alrededor de 20.
specific
Ven, por ejemplo, en
rate
Europa, que
for
también reducen su
teenagers
fecundidad,
around
sabemos que hay muchos
20.
países en Europa que son
We
bastante
know that many countries
envejecidos,
In Europe, we have, for example, many countries that are older, right? Maybe we could have a reduction there. And we see that there's a reduction. But if we see the Andean region, which is what we're located right now, we see the data from Latin America as well. We have managed to work with the rights of adult women, and we have failed to reduce fertility in our children and young women. So if we see the whole picture, and I wanted to focus on Andean countries, we have many representatives of the region, and I would like to congratulate the health organisms with the commitment that they had. And we know that there is a trend to decrease fertility, but we have countries with a slope that is starting to go to the straight line. So that means that we're not actually decreasing suitably. We also know that most of pregnancies are not intentional. And if we divide pregnancy among people that are younger than 15 years and unintentional pregnancies, we have 1,200,000 pregnancies. So we are not preventing pregnancy. We should guarantee access to contraceptive because that teenager that would properly use contraceptive will not be pregnant. I'm sure that Edgar is going to go a little bit into detail with this.
Separada por edades, vemos que las mujeres a partir de los 25 años tienen más o menos una necesidad insatisfecha que está por debajo
We know
del
that this
15%.
is below 15%. And when we see these countries that are represented here, we know that adolescents will not only be guaranteed to have the children that they want to have. Okay, so if we see,
que como decía la doctora
for
Calle,
example,
profundas desigualdades. Nuevamente yéndonos al área andina, vemos que cuando desagregamos la maternidad
whenever we
adolescente
disaggregate
y de pobreza, vemos que
maternity,
adolescentes
we know
que viven
that our
en el límite de
adolescents
pobreza
that are part
más
of
bajo, es decir, nuestras adolescentes
the
más
lower
pobres, tienen una
income,
proporción de embarazos
when there's more
adolescentes mucho
poverty,
mayor
there's a
que
proportion
aquellas
of
que
teenage
pertenecen al índice
pregnancies
de
that
riqueza
those
más
that
alto, que son
belong
las
to
columnas más
the
pequeñas.
highest
Aquí
richness, which are
claramente
the columns that are the
representamos
lowest.
países y
So
visibiliza
this is
una
really
gran
reflected,
desigualdad.
and we are able to
Además, hicimos un
see
estudio
a
de
great
comparar
inequality. So
desigualdad y embarazo
um,
adolescente. Como ustedes saben,
when we're
el
talking
coeficiente de
about
Gini es uno de
adolescent
esos marcadores
pregnancy,
de desigualdad y
GD
vimos una perfecta
coefficient
línea
is
recta donde
important. We
vemos
have
que a
seen a
mayor
perfect straight
desigualdad,
line.
mayor embarazo adolescente, porque veíamos, por ejemplo, países que sí podríamos pensar, como por ejemplo el caso de Honduras, de Paraguay,
For
que
example, if we
quizás
check
tienen un
the case of
producto
Honduras and
interno bruto más
Paraguay,
bajo,
we
por ejemplo, el
have
caso
a
de Panamá y de Colombia, y
product
sin
which is
embargo
lower
teníamos
than in the case
países,
of
Panamá y
Panama,
Colombia, con una tasa
in
de fertilidad
Colombia
de
as
adolescentes
well.
mayor, siendo países con mayor riqueza desde el punto de
We
vista
have
económico en sus países.
countries of
Así
greater
que la
richness.
desigualdad es un
So
claro
you see that
marcador del embarazo
inequality is a
adolescente,
great
y esta distribución desigual entre los diferentes sectores de población
indicator,
reproduce el
and
ciclo intergeneracional de la
it
pobreza.
reproduces the
Este es un ejemplo
cycle of
de
poverty.
Colombia,
So this is an
donde vemos la
example
tasa
of
específica de
Colombia.
fertilidad
We
de 15
see
a 19 años desagregada por
fertility rate
la primera
on the
línea
people from
son
15 to
los
19.
estados
On the first
priorizados, los
line,
que
we
han
have
permanecido
prioritized
cerca del conflicto armado, luego los
governments
alejados
that have
de
been
los
closed
municipios
armed
rurales,
conflicts.
y vemos
The
que
orange, we have
lo
rural
contrario
municipalities, and
digamos, al anaranjadito más clarito,
the
son los
orange, which is
urbanos.
a
Entonces
lighter
vemos cómo
orange or yellow,
prácticamente entre
it's
los que
urban
viven
areas.
en
So
zonas
we could see
rurales
that
y
the
más
people that live in
desfavorecidas
rural
tienen un
areas or
25 más
areas
chance
that
de
are
embarazarse las
that are
adolescentes
under more
que las que
poverty,
están en las
we
zonas
have more
urbanas
chances of having
económicamente
more
mejores.
pregnancies
Y si nos
than in
vamos a
urban
las
areas.
diferencias de
Now,
oportunidad entre
if
los
we
menores de
go to
15 años,
the
vemos que la
fertility rate
diferencialidad
for
es mayor. Un
people that are
adolescente
younger than 10
rural
years
tiene
old,
2 veces más
an
chance de
adolescent living
embarazarse
in the
en el
rural
rural
area
que un
has
adolescente del área urbana.
more chance to getting pregnant in Colombia. So we know that our adolescents, they continue being pregnant throughout adolescence. So that means that half of adolescents that have their first child between 14 and 20 had their second child before turning 20. That means that this young woman went there, she was pregnant, she took the first child to the pediatrics, and nobody gave her any education to prevent this second pregnancy. And if this young woman had her first child before turning 15, 3 out of 4 young women are going to have a second child in the adolescence, and 40% could even have a third child before turning 20. So, for example, when we have 2 or 3 before turning 19, our opportunities could be we know that this is associated to sexual violence. We know that pregnancies, particularly for forced pregnancies, this could be related to inequalities, sexual violence. We know that this is like the egg and the chicken. 45% of um, infant marriages were precursors or predecessors of pregnancy. But we also know that 35% of adolescent pregnancy was a predecessor of child marriage. So to to tackle this early marriages or sexual violence is definitely a strategy to reduce teenage pregnancies. And we know that this is also related to mortality rate. Um, we know that, for example, once the age starts increasing, we also increase the prenatal care. And if this adolescent is less than 15 years old, the rate of prenatal controls is below 70%. So we will be talking about 4 prenatal cares. And if we see the curve of maternity death rates, we see that the pregnancy that takes place in girls younger than 15, the probabilities of dying due to pregnancy increases. But every time a woman is pregnant, we also have complications. So that means that if women is pregnant, um, they have more risk with each pregnancies. So if an adolescent before turning 19, she also have 3 years, three babies already, probably there would be more risks or she would have a great number of children. So I wanted also to focus on pregnancy for women that are minor than 15 years. We see that this is a problem in our region. I don't know if you remember the first slide. We see that there was a slope for pregnancy reduction. So that trend is higher in pregnancy between 10 and 14 years old. So that means that over the last 5 years, we have not done much to reduce pregnancies for young people younger than 15. If we see the Andean countries, we could see that we have an average. This is data from 2023, and this data was extracted from CEPALs. And we see that for 2023, we have a specific rate from people between 10 and 14 of 1.71. And we see that everything in gray, we have the Andean countries, and we see that the fertility rate is way higher than the regional average. Also, I wanted to take you to this chart because some people would think that 2.8, 3.4, maybe that's not that much. what we have done with the support of the consulting company and studies that we have held to analyze pregnancies, we had the task of separate the pregnancies according each age. So if you see orange, we have 2.2, 2.4, 2.1. But when we demanded the information on the number of pregnancies from girls in 14 years old and 13 and 14 years old, we noticed that it was even doubled the average numbers. Why? Because many times it could be that there's a false negative, particularly because they have not started the reproductive life. 9.2 each 100,000 adolescents could be mothers in 19 years old. So that reflects that there's violence, inequality, inequity, and I'm sure that these adolescents are not going to properly develop. So just to finish, and this is something that was mentioned by our Dr. Calle, prevention of teenage pregnancy is not only an individual responsibility, it's a commitment from everybody. We should keep working hand by hand to not let any pregnancies steal the project of our own young women. Thank you. So, thank you. We have had many efforts that we're performing, and countries are actually performing, but nonetheless, institutions, as it was mentioned, a non-institution can do it on their own. We need to do an intersectoral work, particularly because inequality is something that hinders um, teenage pregnancy. We need to work in reducing these inequalities. In that sense, we require a firm commitment because, as it was mentioned, this is not individual work. And on our own, we're not going to be able to do something. We have gone a long way, so we need to contribute so our adolescents could work on their own rights. So we would like you to stay in the room. We have lots of congratulations and questions. We're gonna respond them afterwards. We would like to welcome Dr. Edgar Narvaez. He's from Nicaragua. He's a physician. He has a master's in economy and health management. He also has a master in pharmacoepidemiology. He has studied an undergraduate degree in sexual health and reproductive health. Um, this includes health ministry, social security, research centers, and in the last 17 years, he have worked in UNFA. He worked first in Nicaragua as sexual and reproductive rights specialist, and now he has worked as regional consultant on sexual and reproductive right material securing as well as health system. He was a member of the expert panel of essential medicine on WHO. He has contributed with different countries in the region by providing socioeconomic evidence and also working in improving quality of services of sexual and reproductive rights. He has worked in strengthening supply chain and access of people to essential medicine, including sexual and reproductive rights. Dr. Edgar, you can go ahead.
Muchísimas gracias, Gloria.
Thank you,
Muchísimas
Gloria.
gracias al organismo andino. Me dice la
Thank you
señora
for the
cuando
Andean
vean la
organism.
presentación.
Would you let me know if you can
Muchísimas
see my
gracias.
presentation?
Sí,
Yes, but just
correcto.
can you
Listo.
show it in presentation mode? Yes, thank
Ahora
you.
sí.
Is it
Ok,
available?
perfecto.
Yes.
Bueno, muchas
Okay.
gracias por la invitación.
So thank you for
La
inviting
verdad
me.
es que esta semana es la
This
Semana de Prevención
week
de Embarazo
is
Adolescente
the week of teenage pregnancy prevention, but I believe that every week should be Teenage Pregnancy Prevention Week because teenage pregnancy responds to how each country is working on this. So we're going to move forward with the presentation. Alejandra spoke a little bit about what's the status of teenage pregnancy in the region, how we're doing with regards to other countries in the world. And I'm going to discuss a branch that we have been working in UNFPA. And that would be what's the cost of that teenage pregnancy and why do we need to urgently invest in preventing from the point of view of developing societies, but also the own developing of teenagers. If you see this graph, what I can mention is that teenage pregnancy is an expression of inequality. You could see that if we have more than 50, that means that there's more teenage pregnant. And that's why we have developed a series of tools that enable us to measure what would be the impact of teenage pregnancy from the point of view of cost and opportunity. And also we need to see what do we need to do in this case in order to reduce adolescents' pregnancies or accelerate its reduction and what would be the benefit. So that's why we have performed research which is called Milena. We have done this in 15 countries. We have done this in the region, and we have investment cases. These are tools that would help us to advocate in the highest levels to prioritize um, teenage pregnancies in the public policies, but also we need to finance these strategies against teenage pregnancies because we could have lots of plans or strategies, but sometimes we don't have budgets allocated to implement those. So that's why it is really important that those plans or those policies or strategies, in addition of having goals and results, would have financing for its implementation. The Milena study, it's based on Gary Becker's theory, where he compares the trajectory of two adolescents. Let's mention that, let's say that this is a teenager called Milena. She was pregnant before 20 years old. She left the education system. Then she inserted late to the work activity with less tools. And therefore, throughout her productive life, she has less income. And then we have Esperanza, that was not pregnant before 20 years old. Decided when to get pregnant. She was able to study and move forward in her life uh, project. So Milena, what it does, the program measures the adolescents that were able to reach their goals. And this is what we call cost of opportunities. We measure this in 5 dimensions. We measure this in the reach educational level because it is shown that almost half of adolescents, they stop studying, they leave the educational system because of pregnancy. And just a small amount of these people, they reinsert, but they don't reach um, higher educational levels. So what's the working insertion in the market? Well, we measure individual income and we measure the cost for the government when it comes to responding to pregnancies. And we also consider within the taxing income. So, for example, if we have women that are pregnant and have or they pay their taxes as well. So if a person that because of pregnancy receives less income or because of of their lower insertion was not able to have a good income, she has less income, and that's why the taxes could be reduced for the government. So what we could find is that effectively adolescents that were mothers in early stages, they have 3 times less opportunities of reaching higher educational levels, and they have 26% less of incomes. This is with regards of women that were mothers in an adult phase. And we were discussing in a meeting with different organisms and institutions because this 26%, it's already impacting the inequality gap between women and men when it comes to income. Women, in many cases, even if they have been properly trained, even if they have the same career, the same role in an organization, they tend to have less income than men. So we see that there's an inequality gap. And also, of course, early pregnancies for teenagers could increase that gap. So in the end, whenever we measure just the impact of early pregnancies, we could say that it is 26%. So they have 26% less of income. So how is this translated for cost for the state and society? Well, in 14 countries of these millennial studies, we also have um, 15 countries, but for the moment we only have the information of 14 countries. So we see that the average for all of them is 0.4%. So in a couple years, we are going to be growing by the gross product. But if we consider that that 0.4% is equivalent to 10.4 billions a year for those 14 countries, and the percentage are going between, I don't know, 0.1% from Guyana up to 2.4%, right? So sometimes we would like to see what it means for people, right? In Guatemala, the cost due to loss of income is equivalent to the income that ladies or women stop receiving in order to buy a house, for example. When it comes to El Salvador, the per capita, it's equivalent to 3 months of income in a household, for example. For Panama, it includes, I don't know, $500 million, which is equivalent to the Panama Channel being stopped for 3 months. For Paraguay, when it comes to the incomes, it could be a whole stoppage of 2 months for the whole government. So if we see this in comparison, this is how we could better analyze on what would mean for each country. Now, the impact is not the same for the government and for women. 59% of the impact lays on adolescents, because out of that cost of opportunity, 59% would be on working income and participation of women. And this is further explained because the educational aspect, if you observe here in the analysis, when we reach middle school, yearly income goes up to 3,500, and then it doubles once they reach the higher education. So we could see the impact of teenage pregnancy could impact education, income levels, and working participation. So we can sum up here. For example, Mari Carmen, Alejandra, we were discussing that teenage pregnancy responds to human rights, health, the government, but it's also a human development matter and country development. So that's why um, women pregnancy is focused. And for example, if we see the yearly index, we have obstacles to reducing the circle of poverty. We have seen the probabilities of having, I don't know, a mother that doesn't have contraceptive access. Uh, Probably we're going to have more adolescent mothers in the upcoming years. This also implies higher cost for the government and impact on the socio-economical development of countries. Before discussing on what we could do, I wanted to mention that today is September 26th. Today is the World Day of Contraceptives. And this has actually transformed the life of many women throughout the world. It has changes the life of societies as a group. So the motto this year is a choice for all, freedom to plan, and power to choose. I would like to mention that the access to contraceptive is a human right. It favors health and well-being not only of women and adolescents, but also societies. It is true that some countries had increased their expenses to finance contraceptive access. However, these budgets are below the needs. So that's why many people will have to invest for their own expenses. We also need to invest on freedom of women and adolescents because they need to be able to plan their future, peace, and prosperity. So everybody that is currently working on access to service or contraceptives, everybody will be celebrating this day. But in spite of all of these efforts, there's still different equity gaps. For example, adolescents don't have access to modern contraceptive. We're using short-term contraceptives. For example, we have explanation from Latin America where we see that this is still low when it comes to the average worldwide. With the respective differences, we know that there's differences inside of the countries as well. Alejandra was seeing or was discussing that many adolescents don't have access to modern contraceptive. And also by age, we have gaps by education. We also have gaps by race, civil status, income, areas of residencies. So we have people that don't have access to contraceptives. And this is actually the people that we need to reach. That's why we always say that we need to reach up to the more secluded place. We also see that when it comes to the access to modern contraceptive and unsatisfied demand, we can see all of these countries. This is the information from Montevideo. So once we see the average of Latin America, we know that 70% of women, all of them, have access to modern contraceptive. However, in the total of 15 to 49 years old, the unsatisfied demand is 83%, according to the report from each country from 2024. We still have a relevant amount, but out of those percentage, 42% will be their own expenses. That means that they pay for them. They don't receive the contraceptive from Social Security or the government. They need to buy it themselves. Sometimes they buy it in a very high price. So what happens is, who are spending more money? Well, the people that are the poorest. So that's why we have an inequality gap. in spite of having percentage that could seem high in average, half of them could come out of their own expenses. So we need to continue accelerating efforts in order to have access to modern contraceptives. So discussing the adolescents, we know what's the impact, we know what we could do, and there's two articles from year 2016 and 2017 that mention that we need to include the life project of adolescents, but we need to have access to modern contraceptives so we could use them as soon as we can according to the WHO criteria. So this includes intersexual work.
Todas nuestras legislaciones hablan que esa es violencia sexual y en el grupo de 15 a 40 a 15 a 19 años, donde el
From the group of 15 to 19 years
en la
old,
región son embarazos
64% in the region will be unintentional pregnancies. For example, if we have
que puedan tener acceso a anticonceptivos en el momento que los necesitan.
the right, we can give them access to these contraceptives. Not every contraceptive works in the same way. For example, we could see all the evidence that backs up the fact that we have a greater response by the LARCs. For example, we have the copper T, the etonogestrel implant, we have the implants as well. It has a greater adherence. We have a longer duration, better adherence in the case of the copper T. So there's less secondary effects. So it's important to mention that this needs to be within free and informed decisions and within the eligibility criteria. So we need to give people the chance to choose how they want to plan their own lives. Despite of that, if we see the database that was worked from Lancet in year 2022, we see that we are actually improving. There's access to implants. However, the country that has reached the highest rate, we're talking 10% because most of the countries are 2%. But the good news is that we're improving. In the case of the intrauterine device, the ITU, we see that the use is reduced, but overall, this is below 2% for adolescents. So the WHO criteria for eligibility, it mentions that age is not a hindering aspect to access. We can use them as long as there's no clinical conditions that would stop them for using them. So by using this evidence of education and access, we develop the model of impact goals. And we try to discuss here is how do we create an investment metric and what would be the impact of reducing fertility in adolescents. So this is a way of saying what are the results, what are the goals, but we could measure if this forecast is actually something that we are complying with and if we obtain the results that we were expecting. Something that we would like to highlight, this is including within the models, is that the most cost-effective are long-duration contraceptives. You could see, for example, the estimates here We have efficiencies, adherence, and we also have the real effectiveness of the method. There's evidence that supports the model. And to sum up, basically this is two things: integral education to sex education and modern contraceptive methods. All of this includes family planning within all the concepts, and definitely adherence to this method could improve in 23%. We know that sexual education, of course, contributes to having an early initiation of your sex life, preventing HIV, preventing violence. So basically what we do with MEMI is we put all of this in a box of contraceptive access, and we obtain the results that we're expecting to achieve. An example of a country, for example, we worked some scenarios, and if the total investment is 976,000 or 1,200,000, what would be the profit from the social perspective, and what would be the cost and benefit of those interventions? And in the end, we would have a forecast per year that we could extend up to 5 years of what would be the investment that would be required to prevent teenage pregnancies. That's the socioeconomic evidence that we have. We are developing one related to service cost, and the other one is related to including attention of people with any type of inequalities. So to sum up, we need to invest in the transforming results. We need to um, reverse or reduce unsatisfied needs, and discussing the UNFPA estimation, we know that per each dollar that we invest, we could have a benefit of $8.4. For the case of teenage pregnancies, per each dollar that we invest in teenage pregnancy prevention, we have benefits that could be between $15 and $40 by not depending on the country. What it means is that there's no greater investment that investing on teenage pregnant prevention. So per each dollar, you have a profit of 15 or up to $40. So we need to accelerate teenage pregnancy prevention. Thank you.
Gracias, Edgar. Realmente muy,
Thank
muy
you,
interesante.
Edgar. Actually, your talk was quite interesting. In Horoscope, we need to say that if there's no budget, there's no rights. So your presentation actually show us how important it is to invest properly in health, in education for adolescents. So we need to respond to their exercise of their own rights. So thank you, Edgar. We would love to continue with the work, continue with this drive for each country, because we need to continue investing on health, education on teenagers. So thank you, Edgar. Now, we would love to have you in the room because we're still going to have questions. And once we complete with Carlos' presentation, we're going to start with questions and answers, because I think we could have an active pause because we need to. Rob, could you share the instructions? Rob?
Hola, hola, muy buenos días, buenas tardes desde el Organismo Andino de Salud y el Convenio Hipólito
From
Unanue.
the
Los invitamos a hacer esta
organism
pausa de
Orascon,
relajación.
who
Un
we would
automasaje
like
que te va
to
a encantar.
have a
Siéntate y
massage.
ponte
Sit
estos
down
ejercicios muy
and
quieto.
start
Lleva
relaxing.
tu cabecita
Maybe take
hacia
your
el
head
muslo
to
y
one
hacia el tobillo.
head or
Empieza
the
a
other.
notar la relajación
Maybe
de tu
start
cuello, de
relaxing
tu
your
cuello.
neck.
Inhala
Start relaxing your
profundo.
body.
Exhala. Lleva la
You can
cabeza
exhale,
ligeramente hacia atrás.
move
La
your
idea es
head
que logres desconectarla
from
unos segunditos
left to
del
right.
trabajo
You need to
y
disconnect
quédate
from your
relajado en ese
work,
pequeño
and you could give
automasaje. Lleva la
yourself
cabeza
this
hacia el
massage.
reverso. Con la
Take
mano
your
izquierda
head
vas a
to
empezar a
the
hacer
right shoulder,
pulsoncitos desde el hombro
and
hacia el cuello.
with
Así
your
como si
contrary
fuera que
hand, you
inhalas
could move
unos
your
segundos con fuerza,
move your
soltando
hand. You could
distensiones,
pulse
todo el tiempo con
with your
aire por la
fingers. You
nariz,
can inhale,
exhalo por la
exhale
boca.
by the mouth.
Eso es, de arriba hacia
Very good.
abajo. Ahora vas a colocar tu manita
Now
sobre
you
el
need to
hombro
put your
y vas a
hands
empezar a hacer
on your
puntitos
shoulder, and we
como
need to do
trenecitos
like
del
little
hombro hacia el
pinches
cuello,
from your shoulder to
buscando
your
agarrar tu
neck.
espalda, que
Maybe
súper
find that
bien, que quede
spot in your
generar
back that
presión,
tends to generate
puntos
some
arriba. Esto
tension.
también lo puedes hacer
You
con
could
una
press a
gelatina,
little
una
bit.
cremita. Ahí
If
donde
you
lo
have cream,
encuentres,
that would be
muy
better.
bien. Regresa suave.
Now
Vas a llevar la cabecita al
we
hombro
need to
contrario y nuevamente
take this your head
pulsoncitos
to
de
the other
arriba hacia
shoulder,
abajo.
and then we start
Ahí
pulsing.
con la yemita de los
With
dedos,
the
el
tip of your
movimiento,
fingers, you can
como
press
caminando
there. It's like your
hacia el
hand
cuello.
is moving all
Inhala,
along your neck. Inhale
exhala.
through your nose and exhale through your
Muy
mouth.
bien.
Very
Nuevamente
good.
manita sobre el
So
hombro,
now put your
ejercicios
hand on your shoulder and
desde
start
arriba
pitching a
hacia
little
abajo.
bit
Intenta
upwards
simplemente
and start
relajarte,
going downwards.
descansar
Try
unos
to relax a
minutos,
little bit, rest a little
apoyitos
minute.
acá en la zona del
We
hombro.
could do
Más
some
bien,
movements in
más
the
bien.
shoulder with your hands. You
Muy
need to
bien. Ahora vas a
massage as
llevar
well.
tus dos
And
manitas
now
atrás
take
del
your
cuello.
hands
Vas a
behind
empezar a
the neck.
masajear y
You're
vas a
gonna
hacer
start
como
doing
si
a little
deslizándolos
massage,
hacia atrás,
and then
hacia adelante,
you
como
need
si
to
limpiaras tu
slide
pecho. Entonces,
your hand
inhalo,
upwards
exhalo,
as you were cleaning your
deslizo.
neck. So you need to inhale
Inhalo,
and
exhalo,
exhale.
deslizo.
You need to
Eso es.
slide.
Ahora lleva tus
And now
manos
take
hacia
your
adelante.
hand to your necks
Mueve tus
and try
dedos
to
de arriba
move
hacia abajo,
your
baja por tu
fingers
cabeza.
upwards and
Eso
downwards
empiezas a
and
hacer
start
nuevamente los
doing
pulsoncitos hacia toda
this
la zona cervical.
pressing with your
Hacia
fingers
todo.
in the
Aquí es donde
cervical
inicia el cabello. Masajea de
core,
forma
and you can
circular. Este
massage
cabello
in a
está
circle. This is a
desde arriba quitándote
tension
tu
spot that would
cabeza,
help us to
los
reduce
auriculares.
headaches, reduce
Eso es.
muscular
Masajea
pain.
de arriba
Now we're
abajo.
gonna go
Eso, muy bien. Con
from
las
downwards
palmas y la
upwards.
yemita de los dedos. Muy bien. Ahora
So
vamos a
now we're
terminar con un
gonna
estiramiento.
finish
Hacemos
with
así estiramientos
stretches, and this
relajados
will
con
help
los
us
hombros.
with the
Lleva la cabeza
relaxation.
con hombros.
We need to take
Mantén ahí
our
unos
heads to
segunditos.
one
Controla la
shoulder.
respiración. Inhalo.
I wanted
Exhalo.
to inhale and
Nuevamente.
exhale. Let's
Inhalo.
change. Inhale, exhale.
Exhalo. Palmas en forma de
We could
oración.
have
Llevándolas
our
hacia el
palms
front y
as
suave.
praying, and we could put it in our
Unos
chins
segunditos
and
ahí.
going
Inhala
up.
profundo.
Maybe stay there for
Exhala.
seconds,
Ahora
maybe
lo
inhale,
contrario. Hacia
exhale,
abajo
and
abrimos
now the
nuestros
contrary, we
muslos.
need to
Muy bien.
take
Regresa.
our head
Eso es. A
downwards.
todos los
And
países, Bolivia, Chile,
for all
Colombia,
countries,
Ecuador,
Bolivia,
Perú,
Chile,
Venezuela,
Colombia,
desde
Ecuador, Peru,
Orascon,
and Venezuela,
hacemos
from
otra
Orascono, we would
pausa
like to
de
invite you for
relajación.
this
Relajación. Espero que haya
break and this
descansado.
relaxation exercises. Thank you.
Bueno, muchísimas gracias. Yo creo que
Thank
esta
you.
pausa era
And I
realmente
think that this
necesaria y
pause was necessary.
permite recordar lo
And I think
importante que
that it
somos y
helped
los
us
pasos que
to
tenemos que dar
remember
en
how important we are
cada,
and the
en cada cierto
spaces
momento
that we
para
need to
retomar lo necesario
give to ourselves in order to continue with our activities. So now we need to continue with our webinar. We would like to invite Mr. Carlos Gutierrez Morillo. Carlos has over 14 years of professional career in international cooperation field. He has been in positions within different entities in the UN system, for example, ACNUR, PINA. He has been a resident coordinator office, and recently he has worked in the regional office of UNFA as Foreign Affairs Regional official. He has a degree in international studies in Central University of Venezuela. He has undergrad studies in political and government studies in the Metropolitan University in 2017. In 2018, the Klingendales Institute in La Haya granted their certificate for him in negotiation and mediation as instrument of conflict resolution. In 2019, he has become, or he received his master's degrees in political science for the UAB in Spain. His hobbies are to play chess, and he does surf paddle. He loves salsa and sports. Welcome,
Buenos días,
Carlos.
gracias todas y todos. Muy contento de
Thank you.
sentirme
I am quite
parte de
delighted to
esto.
be part of this
Saludar por
presentation.
supuesto a
I would
Alejandra y
like to
Edgar,
greet Alejandra and
agradecería las
Edgar as well
presentaciones
that came
realizadas en las
before me.
presentaciones maravillosas y por
Um,
supuesto también hacer eco
we would like to, I would like
el
to
Día Mundial
mention
Anticoncepción, pero también
that
el deseo
today is the
de
World Day
prevención
of
para todas las
Contraceptive
pequeñas
and the
mujeres.
week of
Hoy les voy a
teenage
compartir
pregnancy prevention in our region.
una iniciativa que
I'm
hemos
going to
llevado a cabo
share an initiative that we were working
con el
on
Comité de
from the
Salud
regional
de
office
UNFPA.
in
Enseguida
UNFPA.
logro compartirles la
And
presentación, un
just
segundito,
give me
por
one
favor.
second till I share the presentation.
Una presentación que acompaña las preocupaciones que
So we
fueron
have a
resaltadas
presentation
por Alejandra y Edgar
that shows the
en términos del contexto
concerns
en el
that
que la
were
Latin
raised by
American
Alejandra and Edgar. This is the
Adolescent
context
Program
that Latin
lidera
America and the
la
Caribbean
región
are going through.
adolescentes se convierten en
Each
madres.
minute, 4
Entonces,
children and adolescents are becoming
compartir
mothers, and
conocimientos
this was something that was
vitales
mentioned
para la generación de una
that
causa común
should
y
summon us
importante
for the
acción
common
de
cause.
manera
We should take
integrada
actions
abordar esta
that
situación.
should help us to
En ese
tackle this.
marco,
And
en ese contexto,
in this
desde la
context,
Oficina Regional del
from
Caribe de las
the
Naciones Unidas para la
regional
Adolescencia,
office,
un
we are
proceso
trying to reflect
interdepartamental
on
que aborda
what are
la
we going to
situación
do. This should be a
anticonceptiva.
cost that should
Para ello tomamos
tackles
en cuenta
structural challenges.
el
So that's
Día
why we
Mundial
have these
Centrado en el
initiatives.
Adolescente, con la idea de que sea una
Um,
oportunidad
the
única para
idea is that this
entrelazar
would be an
esfuerzos
opportunity
de
to
todos
link
los actores a
efforts
nivel
of
regional
different
y compromiso
sectors
para
and
lograr
scale
estos
this.
objetivos. No voy a entrar en detalles
I'm
sobre
not
los
going to get into
compromisos que fue el
details
trabajo
on the
realizado por los
context because
expertos,
this was properly
pero sí
highlighted by
compartir
the
la realidad.
experts.
Vieron cómo nuestra región
So
ha
we
sido
have
la segunda con
seen
la tasa de
how
fertilidad más
our region
alta de
is
la
the
región,
second
con
with the
14
highest
países en la región, 14
fertility
países
rate,
promedio efectivamente.
and 14
El
countries in the
impacto
regions are way
del
above the regional
desarrollo en
average.
nuestra
We
región,
have a
cerca de cada
socioeconomical
uno de
impact
los
in our region,
5 niños
and
y
also
adolescentes
of each
afectados
five
por
adolescents
situaciones
have been exposed
negativas
to
como por ejemplo la
situation of
penetración
harmful
de las causas
practice, like for
que,
example,
que
early
permiten el embarazo
marriage.
adolescente en nuestra región.
These are one of the
Pero hay un
causes that
contexto adicional
increases
que se
teenage
suma
pregnancy. But there's something
y es que
that
vemos que aún
contributes to this.
cuando
We're
este
seeing that even
adolescente
when the impact to
emerge
teenage
como paciente,
pregnancy is happening,
aún sigue
we
siendo
see that
invisible
this
para
is
muchos
invisible
encabezados en las
when
agencias
it comes to
gubernamentales en nuestra región.
the
Adicionalmente,
governmental
las asignaciones
agendas.
presupuestarias no
And
son las más propicias para acompañar
we don't
políticas
have
públicas.
much budget
Entonces,
to
si
go
no
along
vemos
uh,
con políticas públicas de calidad
with
y
this public
estratégicas que también estén respaldadas por los
aspects.
presupuestos para
And this should be backed up
y es a
by
esa brecha
budgets,
que
as you can
añade
see.
la
And this
ineficiencia y
gap
ineficacia
generates an inefficiency when it comes to responding to early pregnancies. Now, part of the challenge that we're seeing is that there is a large fragmentation in the data. There's actors that are committed to tackle this situation, and sometimes this is not changed to the effort, and it would cause that we would have an impact. In the face of this context, we have included the initiative that would include a multisectoral platform in which we could include the efforts from different sectors, but also this would be helping us to combine the perspective and socioeconomical perspectives. And in addition to the synergies, we could accumulate experiences, commitments around common agendas. So we want to have the platform, civil society, cooperation agencies, banks, and the common agenda translates into having three strategic lines. One, an interinstitutional dialogue. Um, this centers the efforts as well, prevention and reducing this, and it could be a mechanism for reference and higher reference in a region. So also we need to consider the alternatives that are available.
Finalmente, que logremos armonizar la recolección de evidencias y las estrategias de abogacía para que basadas en datos podamos generar instrumentos
So
que
once we're
permitan que los
based
formadores
on these cases, we could take decision, we could have practices as well.
corresponde al abordaje del embarazo adolescente. ¿Cómo empezó la iniciativa?
So how does this started? Well, we move forward with countries, and we were trying to move forward on efforts that prioritize the attention of teenage pregnancy in their countries because we want to secure initial commitments. And we start involving any other allies that, of course, they focus their actions around pregnancies. Also, we need to take advantage of regional and intergovernmental platforms. So on that base, we need to see the initiatives that could be adequate to other efforts that we have in the region. As part of this conceptual focus, we would like to start consultation on November 14 last year in the celebration on Montevideo. We started discussing with Chile, Uruguay, Panama, with the SICA as well. And we started reflecting on the possibility of having initiatives like this. And we receive the idea of having multisectoral purposes. After having
por primera vez celebramos una plenaria
these considerations,
misión permanente de la República de Panamá en Nueva York en el
we were
marco
thinking
de la Comisión de
about
Población y Desarrollo.
continuing with the framework of development, and we started defining what's the governance strategy. We started to see how initiatives like this could be part of the region. So we had a final moment, which was the second plenary, and we were trying to involve. We decided what were the groups of work to start with the strategic work. We were starting to include evidence as well, and we were starting reflecting about a second moment where actually we could show concrete products and discuss as well. Here is a model of what was what that happened in Cartagena. It was the second plenary of this initiative. This was launched by the minister, and there was there were other representatives from these organizations. There was the presence of developing banks, cooperation organizations, civil society. There was presence of the private sector. We noticed that we managed to establish the basis for initiatives that could be part of the region when it comes to preventing teenage pregnancy. To sum up, with this strategy, along with what my other teammates have introduced before, we are trying to bet on an approach that combines our efforts when it comes to international interventions. We were trying to include different services when it comes to the teenage pregnancy, investment, and having a platform that help us to reduce the gaps. We need to prioritize the agendas as well to take decisions. So there's no time to change, but I think that we can integrate this with the efforts that other entities are performing. And we would love to have you here as well. Thank you, Carlos, for your involvement. Actually, this initiative is something that calls us to action. I think that definitely it commit us with intersectoral aspects. And I think that definitely we're able to contribute there with the health of our adolescents. So we are quite surprised because there's a big amount of questions. So I think it's necessary to start the dialogue that we established, that we have considered. So we need to see who would respond. For example, what would be the most effective strategy from UNFA? We have identified this for prevention of uh, teenage pregnancy in the Latin American region. That's one question. And then I'm going to mention the other one. How are these going to be adapted, these strategies? So this could be sensitive and of access to our communities. So thank you.
Perfecto, comienzo. Bueno, muchísimas gracias. Tuve la oportunidad en mi teléfono de meterme en YouTube, más de 100 personas
I
conectados en
was
el
able
canal de
to get
YouTube y se han
into
permanecido
YouTube. There were more than
durante
100
toda
people.
esta mañana, lo cual demuestra el poder de convocatoria que tiene
So
el
this means
organismo
that
andino de
there's
salud y por eso felicito
a good
realmente este
um,
espacio. Gracias por las
a good
felicitaciones y por los
group
comentarios
of
y sobre
people
todo
that are
por el
listening to
interés.
us, and thank you
En
for the
prevención del embarazo
when it comes to
adolescente,
teenage
las estrategias,
prevention,
la verdad, no
uh,
son tan
teenage
novedosas.
pregnancy prevention
Lo que sí
strategies are
podríamos
not as
decir
a
que es
novelty. So
novedoso
what we could
y
say is
innovador es la estrategia de justamente
that we have
acelerar esas
strategies of
intervenciones
speeding up
y de alguna
these
manera llegar a los
interventions,
adolescentes
or
hasta
maybe
donde debemos llegar,
reaching
lo cual va a ayudar
adolescents
a
that
responder
maybe
los
were not
problemas
reaching
inmediatos.
before. And this is going to help me to answer the other
Primero, es
questions.
necesario
For
tener una
example, we need
política
to have
y
policies
una
and we need to
política
have
específica claramente dirigida para la
uh,
garantía
something
de las
that
acciones
responds
dirigidas a
the
reducir el embarazo
warranty
adolescente.
of all
Y
of
esa
the actions.
política pueden variar de muchas
So
maneras.
these
Puede ser
policies could
específicamente una
change
política para prevenir embarazo
some
adolescente,
way.
pero también
It
puede
could be
ser
a
una
policy to
política de
prevent
desarrollo
a
adolescente que
teenage
incorpore, por
pregnancy,
supuesto, acciones
but
dirigidas a
it
prevenir
could
el
include
embarazo
actions
adolescente.
that could
Puede
help
ser
us
una
to
política de salud
prevent.
pública que
It could be
fortalezca la salud sexual y reproductiva
politics,
y que tenga un enfoque
um,
diferenciado.
that could
Hay muchos
have a
ejemplos entre
different
países
approach,
y
right? So
cuando
there's
se
many
empiezan o
examples
empiezan
from
a hacer
countries.
acciones muy
We need
específicas en esas
to make
políticas
sure
para
that this
abordar
needs to
a
be
la población
specific
adolescente,
actions
tanto la
to
menor de 15 años como
tackle
la mayor de 18, con
adolescents.
acciones
As
claramente
we can see,
diferenciadas, cualquier política, no importa el nombre que se le ponga, podría ayudarnos. Es
um, I
importante
think that
implementar
definitely this could
políticas
help us.
y un
We need to
programa
have
financiado. Como
policies or
decía
programs that are
mi colega
financed because, like
hace
my
muchos
colleague has
años, y como
mentioned
lo
many
repitió, lo
years
reafirmó
ago,
más políticamente la
and
doctora Calle,
it was mentioned
política sin
by Dr.
presupuesto
Calle,
es
Dr.
demagogia.
Calle, the
Entonces, es
policies
indispensable
are
dar los recursos para que estas
or
políticas puedan
include that
realizarse.
we need
El compromiso
to
político es fundamental, el compromiso
have
del
this, right?
mantenimiento.
We
Y aquí
have
tenemos
a
un organismo andino de
commitment,
salud que tiene una política
and
andina de prevención de
we
salud
have
adolescente que de alguna
Andean
manera implica a todos
policies
los países
that
del
in a
continente.
way are
En
linked.
segundo lugar, es necesario garantizar
So it
servicios
is required
que
to
brinden
guarantee
atención a
services
la población
that could
adolescente. Se
provide
han tomado
attention.
de muchas maneras,
For
servicios legales,
example,
servicios
if we
diferenciados,
include
tienen que estar basados en estándares
differential
y,
aspects, it
y
needs to
esos
be
servicios
based
deben
on
garantizar el
quality
acceso a
standards, as
mecanismos
this needs to
efectivos a esta
guarantee
población.
access to this
Que no existan
population.
barreras para que los
There should
adolescentes puedan
be in
llegar
no sense
realmente a los
barriers for
servicios para
people
usar
to
estos métodos y focalizarlos
access
también
these
al
methods
publicado
and
de quiénes
focalize as
los adolescentes
such.
y consentidos de larga
So
duración, porque hay que entender al adolescente.
we
No
need
basta
to
con decir que es un niño
understand the
atractivo, que la
adolescents.
muchacha tiene que además ocultársela
For
a la mamá
example,
para que no la vea. Muchas veces se
sometimes
la
they
da
need
al
to
novio,
conceal their
entonces todo ese
pregnancy to
pelear con el
others.
novio, ese día no toma la
Sometimes,
pastilla.
if they
Y
have
los
fights with their
consentidos de
boyfriends,
larga
sometimes they
duración
don't
son
take
sin
the
lugar a
pill. So
duda muy acordes
I
para la
think that
población adolescente.
we need to have long
Tercera
duration
intervención,
contraceptives.
educación
When it comes to
integral de la
the
sexualidad.
third
Nuevamente,
intervention,
pueden ponerle el
once
nombre que
again,
quieran. Educación integral de la sexualidad,
um,
educación sexual integral,
if we talk about
derecho
sexual
a la vida,
education,
educación para la
education
vida
for
en familia,
life,
siempre y cuando
and
esta
so forth,
educación
I
esté
think
basada en
that
estándares y de
this
alguna
needs to
manera
be
promueva el
considering
ejercicio
the
del derecho de los
standards
adolescentes a la
and
información
the
relacionada, por ejemplo, con
exercise
los métodos
to have
anticonceptivos,
information.
esta educación integral de la sexualidad pues
So
contribuirá, como bien
this would
explicaba mi
contribute,
colega Edgar, a
like
reducir
my
el
colleague has
embarazo en los
mentioned,
adolescentes.
to
Y
reduce
último,
teenage
pero no menos
pregnancies.
importante, garantizar
And
el
last but not
empoderamiento de
least, we need
nuestras
to
adolescentes.
guarantee
El
that our
empoderamiento y el
adolescents are
fortalecimiento de los
empowered.
proyectos de vida de nuestras adolescentes. Mantener a las adolescentes
We
en la
need
escuela,
to
garantizar la
keep
continuidad del proceso
adolescents in
educativo,
the
garantizar que
schools, for
estén en un
example. We need
ambiente
to
de vida que puede
guarantee
ser
that
el fútbol,
there
que
is
puede ser
a
un canto, que puede
project
ser obras de
that it could
teatro,
be
que puede
soccer,
ser
it could
cualquier otra
be,
actividad que de
I
alguna
don't know,
manera genere un proyecto de
any
vida. Se ha
activity
demostrado,
that
por
could
ejemplo,
generate a life project. For
iniciativas
example, we have
deportivas que
included
generan que las
initiative
adolescentes se incorporen en el
or
fútbol, en otras
sportive
actividades de cuidado
initiatives, for
femenino. Todo
example,
esto son
that
estrategias protectoras para muchas cosas,
adolescents
incluidas
could
la prevención
be
del embarazo.
included.
Entonces, estas cuatro iniciativas son
And
realmente
these fourth
fundamentales para
initiatives
que
are
podamos hablar de
fundamental
prevención de embarazo
for us
adolescente.
to discuss about teenage pregnancies.
Alejandra, realmente muy completa la respuesta. Acá hay
Quería
una
complementar
Thank you,
sí,
Alejandra, for
Gloria,
your
solo
answer.
complementar que creo
So
yo
just to complement here
la que Alejandra
something,
decía.
I think that Alejandra
Lograr
was
que
mentioning
políticas
this,
y
but these
estrategias tengan metas
strategic
claras e
plans
indicadores.
have
Eso es
strategic goals
fundamental.
and indicators. So
Nosotros
I think
también
that that's
tenemos
fundamental
diferentes
because
planes,
we also have
muchos
different
de ellos en
plans.
dotación de
Many of
financiamiento y
those
otros en
include
salud y
financing and
juventud. Y
other
otra cosa muy
goals, but
importante
something
es
that it's
fortalecer los
important
sistemas
would
de
be
información
strengthening
para poder
information
tener
systems
información y
in order
datos
to
desagregados de
have
adolescentes,
information and
para poder
disaggregated data
identificar la
of
cobertura
teenagers and
efectiva que estamos dando.
identifying
¿Y qué es la
the
cobertura efectiva de
extension
mi
that we
población
are covering.
adolescente? ¿A cuántos estoy llegando?
We need
¿Y
to
con qué
see how
calidad lo
many
estoy
people we're
haciendo? Eso
reaching,
es muy
what's the
importante.
quality
Y
that I'm
agregaría,
having. And I
para que
would
era la
like to
segunda parte de la
add
pregunta que hacías, cuando hablamos de responder a
that
necesidades, esto incluye el enfoque intercultural,
once we discuss the
poder
needs,
incorporarlo
we
y
need to
de hecho
mention, for
nosotros tenemos un
example,
proyecto en
and
las regiones de la
incorporate
costa
this.
Caribe de 5 países de Centroamérica, se llama No dejar a nadie atrás, y estamos trabajando en la inclusión de la interculturalidad
We
en las
need
normas, las
to
estrategias, las políticas y en los servicios
include the
para que respondan
policies,
a esas necesidades específicas de la población.
the
¿Qué es lo
responsive
clave?
needs of the
Es en trabajarla
population. We need to
territorialmente
work
a partir de esa
and
visión de esa cosmovisión de las
having
comunidades
this
e
cosmovision
involucrar a
of
los líderes y
communities and
líderes de esa
involving the
comunidad
leaders
como actores
as
fundamentales en ese
fundamental
proceso
actors
para
in
que pueda
those
integrar los
process, so we
servicios
could
de manera
integrate the
apropiada.
services in
Eso
a
es lo que
suitable way.
puedo comentarles, completar un
So
poco a
this
lo
is
que
something
ya
that I can
les
mention
venía
with
explicando
regards
Alejandra.
to
Muchas gracias.
what Alejandra has previously explained.
Muchísimas gracias, Edgar, por la respuesta. Realmente completó toda la presentación o la respuesta que nos
We
había
have
dado Alejandra.
completed
Muchas
all the
gracias.
presentation with Alejandra,
Para
and
Carlos.
I think that this
¿Qué
question is
papel
for
juegan
Carlos
las
as well.
asociaciones
What
o
would be the
gobiernos
role
locales y
of
organizaciones no gubernamentales
non-governmental
en el fortalecimiento
actions?
del
So
impacto de los
this would
programas de
be
prevención del embarazo en
when it
adolescentes?
comes
¿Cuál
to
sería la estrategia para evitar el embarazo temprano en nuestros adolescentes?
preventing
Adelante, por favor.
pregnancies.
Muchísimas gracias, Gloria. Quizás, por supuesto, yo introduzco desde la lógica de asociaciones y alianzas, pero con mucha digamos, propiedad. Alejandra seguramente pudiese reforzar sobre las estrategias a nivel local de cómo
We
avanzar en la
could
prevención
reinforce
y la prevención del
the
embarazo
local
adolescente.
strategy
Fíjense que atándolo también
and
a la pregunta anterior sobre cómo
discussing the
hacer que esta iniciativa
previous
cuente
cases, how these
y con un
initiatives
enfoque,
could have
digamos, de inclusión,
an
diversidad y
inclusion
representación de
approach
distintos rostros que deben ser
and the
considerados
different
para poder
phases that should be
participar
considered for the
democráticamente con el
description,
mismo. Ese es el
as well
espíritu
as
propio también del
the
movimiento, cuando
construction
estamos hablando de saberes,
of these
intereses,
strategies. So
aspiraciones
we
y
need to
conocimientos, y
consider,
la participación
for
de estas
example,
organizaciones justamente trae distintos enfoques para el
how are we
abordaje
providing other
y es
approach
un lujo
for
contar con
what
una
we're
plataforma
expecting
que
to
también
do?
tiene sus buenas prácticas y lecciones
And I
aprendidas
think that we
para
also
ir
have
en el
good
diálogo con estas
practices
organizaciones justamente las estrategias que queremos definir. Por
with
ahora
the
tenemos
strategies that we want to define. So for now,
organizaciones que tienen, digamos, una mirada
we
más
have
regional, siendo que
organizations that
también
have
tenemos que
regional
verlo
looks.
regional para subirle
And I think
seriamente
that
también al compromiso del que hemos hablado, porque una
we
vez
have a good
haya
commitment because what we
una
want
sola
is
excusa
not to
para que
have
esta región
a
sea
single
el centro
excuse
de
on
referencia
why
y
this
de trabajo
region
del mundo.
is
Lo que
the
queremos entonces
is the
es que la
one that
iniciativa del movimiento
it
esté en
has
torno a los compromisos políticos en los mecanismos
the
regionales,
rate
la
in the
falta de
world.
financiamiento y
So we have the lack of
la concentración
financing.
la concentración de evidencia sea de manera consistente para la
Concentration
prevención
of
del embarazo
evidence needs to
adolescente.
be
Yo lo dejaría desde
consistent.
allí
So I would
y
leave it there from the
la
logic
iniciativa
of
contempla también
initiatives. And as you know,
¿no? Que por
it
supuesto tiene un
includes
reto muy grande
teenage pregnancy. So there's lots of
la
challenges
plataforma, las
to
voces
see
de las
how
regiones
we're going to
municipales
include the voices of local
contribuyan a
authorities
ese compromiso
and
político,
communities
pero seguramente
to
Alejandra
contribute
tiene
to
un
the
conocimiento
regional
compartido
concept. I'm sure
de
that
a
Alejandra
nivel local
has this
de los
concept
articuladores clave para la
on how
prevención
to
y
articulate
garantía de
this
adolescentes.
in
Alejandra.
in the best way.
Muchísimas gracias, Carlos.
Thank you,
Absolutamente. Nos
Carlos. And
dijeron, no sé si recuerdan, hace 15
as
días
mentioned,
en
I don't
Santo
know if
Domingo,
you remember that
nada
we
para
were
nosotras sin
15 days ago
nosotras,
in
nos
Santo
decían las
Domingo.
adolescentes.
Um,
Entonces, las
so
organizaciones juveniles, las organizaciones
adolescents
de adolescentes tienen que formar parte de la solución.
need to
Es
be part of the
indispensable.
solution,
Y
and
las
this is
adolescentes no somos una
important.
población
And
homogénea,
teenagers,
todas igualitas.
they are
No,
not all of
hay
them,
adolescentes
they're not the
rurales, hay
same.
adolescentes
There's
indígenas, hay
adolescents that
adolescentes
live in the
no, hay
rural
adolescentes
side,
raperas, hay
there's
adolescentes
indigenous, there's
reggaetoneras, hay adolescentes
people
rurales,
that
hay
like
adolescentes
rap,
afrodescendientes,
reggaeton, there's
adolescentes
people
con
that live from
discapacidad.
the
Entonces, es un
Afro-American
mundo muy heterogéneo
community
donde el
with
adolescente está per
disabilities.
se
So
y es importante hacer
adolescents as
acciones que
people
vayan
are
dirigidas
all
a cada
different. So we
una
need
de estas
to
adolescentes,
include
con siempre el lente de la desigualdad,
information
sin
that
dejar a nadie
responds
atrás.
to them.
Porque sí, cuando digo un adolescente
So
con discapacidad,
once
sí,
we
los
have
adolescentes con discapacidad
adolescents
motora, con discapacidad visual, con
with
discapacidad
any type of
cognitiva,
disability,
están en una situación de
they
mayor
are in a
vulnerabilidad. Hay que
situation of a
definir
higher
estrategias para
vulnerability. We
ellos,
need to
no los
define
adolescentes
strategies
sanos.
for them,
Y hay
particularly
que
the ones that
fomentar y las
are
adolescentes
less
en las comunidades
than
indígenas
3 years.
también,
So
desde su espacio cultural, desde su
coming
propia
from the cultural
cosmovisión y su
side
diálogo de
and their
saberes.
own
Hay que definir
cosmovision,
acciones que
we
vayan
need
de
to
la mano
define
de las
actions that
organizaciones
go
de las
hand by hand with the
organizaciones.
organizations that are
Absolutamente
represented by
indispensable
them.
si queremos que una
It
intervención
is
realmente cuente
indispensable
con un
to
impacto
have
positivo y sobre todo
an
sostenido.
impact particularly that will be sustainable. Thank you, Alejandra. And now we have other questions. What are the successful experiences in teenagers with chronic disease when it comes to pregnancy prevention? You can go ahead.
Nuevamente respondo.
Yes, I would like to respond this question.
Me va a
And
permitir hacer una
I
reflexión
would like to
en
do a
torno
reflection
de
there
las
when it
enfermedades
comes to
crónicas y un caso
chronic diseases.
en estos días
And
que creo que resonó.
I think that this is something that resonated with
Nuevamente,
us. But once again,
el abordaje
the
individual en un servicio de salud
individual
del adolescente es fundamental. Una vez que el
response
adolescente llega al
is
servicio de
fundamental because
salud,
once the
ese
teenagers reach
adolescente
the
es una
health
persona
system, this
integral,
adolescent is
cuenta una
somebody
historia, que viene de
integral
una familia,
that is
que vive
telling a
unas heridas
story,
y
that they
sí,
come from a
puede ser que tenga
family,
una enfermedad
and
crónica, una
it's
enfermedad
highly likely
aguda,
they,
por
they have a
ejemplo,
chronic
el método
disease.
anticonceptivo
For
que se quiera
example, we
prescribir
have
tiene que ser un
contraceptive
método
methods,
anticonceptivo
and
que
this
de
needs to
alguna
be a
manera
contraceptive method that in a
permitido,
way
por decirlo así, con la
could be
enfermedad crónica
enabled,
que esta paciente pueda
and
tener. Pero siempre
this could be related
entendiendo
to the
que una
disease that
paciente
the
con una enfermedad
patient could have.
crónica
So
tiene derecho a una sexualidad responsable.
the
Porque a
chronic
veces
disease
pasa,
patient
y
has
bueno, lo
rights
digo en mis tiempos de médico especialista en servicio,
to have a
que pensamos que
social
esa
reproductive life.
paciente que
So
tiene un
we think that
lupus o
this
esa paciente
patient
que una
that has
cardiopatía o esa
a
paciente que tiene
problem with the
un
heart
trastorno renal
or a
o
renal
una
failure
leucemia,
problem or that has
no
leukemia,
tiene sexualidad y
but they
que
do have
diagnosticaron la
sexuality.
enfermedad
So
crónica cuando tenía 8 9 10
sometimes
años
they were
y ahora tiene
diagnosed when
16
they have chronic
17
disease, but
y
now
sí,
she's
quiere tener
16
un
or 7
novio y
and
sí,
she
quiere
wants to
tener
have a
relaciones
boyfriend
sexuales.
maybe.
Entonces, hay que
So
adecuarse
we
a dar
need
ese
to
adolescente
adequate
como
to
una persona
the
que tiene
needs
derecho a una
of that
sexualidad responsable
teenager.
y no pues
And
simplemente obviar
let's not
ese
think
derecho de esa adolescente.
about these people not
Existen
having
los
the right to do
mecanismos
so.
y
There's
existen
mechanisms,
las intervenciones en
um,
términos de métodos anticonceptivos
interventions,
que son lo suficientemente seguros para
which are
prácticamente cualquier enfermedad
secure enough
crónica que pueda tener un adolescente.
for any
El
chronic
riesgo del
disease
embarazo,
that they may have.
sin
And the
embargo,
risk
puede
of
ser muy grave
pregnancy,
en una
however,
persona con una
will
enfermedad
be
crónica.
quite
Entonces, el
serious in people
costo-beneficio,
with chronic disease. So, yes. Just one question because I think this is related to Edgar. What are the specific strategies that have implemented to increase investment in programs for access and sexual education? I don't know if this
Seguro que
is
sí, mira,
something you
hay
know.
varias experiencias.
Yes, there's several
La recomendación
experiences.
general es,
For
obviamente, que tengamos
example,
presupuestos
we need to
y en
have
el caso
budget,
que tengamos buenas
and
estimaciones
if we
respecto de las
have
necesidades,
estimates according to the
estas
needs,
estimaciones sean
these
prospectivas y que nos
estimates
permitan
need
tener
to
una
happen in
visión de la
perspective because
inversión
this enable to have
que
an
también
investment
sean presentadas
that could
ante los
be
tomadores de decisión
included.
el financiamiento, que no siempre son
And
los
sometimes
responsables o las responsables de los programas.
these people are
Es
not
muy
responsible of
importante,
the
decimos,
team. Sometimes
dar la
it
tecla de
is
quien
quite
mueve el
important
billete,
to
¿no? Quien
see
aprueba el
who is going to
financiamiento. Eso es
provide
muy
financing
importante
in this
llegar con
case. So this is
evidencia. Y
relevant,
luego
it's
de
important to
eso,
have
en procesos más
evidence. And
avanzados,
after
tener
that,
presupuestos
we need to
protegidos,
have
también líneas
budget, which would
presupuestarias
be
dedicadas. Pero
um,
hemos tenido una
with
experiencia que muchas
budgetary
veces esas
lines, but
líneas
we have
dedicadas se
had
quedan estables. O
experience
sea, definieron
where
500 mil
this is
dólares y
stable.
pasaron
We
10
could
años y no eran los
define
500 mil dólares y las
um,
necesidades fueron aumentando.
the
Entonces, que
need,
esas necesidades
and
respondan a una
these
estimación
needs could
prospectiva que
increase.
sea
So
variable
this needs
y
to
que tengamos
respond to
definidas
variable
fuentes de
aspects.
financiamiento y una
We
experiencia
could
muy
have
emblemática en Guatemala,
defined
por ejemplo,
sources. We have
donde
experiences in Guatemala
del impuesto a las
where
bebidas
out of
alcohólicas
the
definieron un porcentaje para
tax,
financiar la salud
there
sexual y
was a
reproductiva,
percentage
la
that was
planificación
defined
familiar y
to
la adquisición
finance
de anticonceptivos. Esa es
planning.
una buena
And
experiencia.
this is a
Paraguay
good
tiene una
experience. I
experiencia
think
muy
Paraguay
buena
has also
con la
has
ley de
experiences in
parto
this
seguro
case
también. Tiene
with
un
the
financiamiento atado unido a la
safe
política que también incluye la adquisición de insumos, etcétera. Entonces,
pregnancy
experiencias hay
access.
muchas.
And
La
so there's
clave
lots
es
of
definir
experiences.
los insumos,
The key is to
hacer
define
adecuadas estimaciones de
raw material,
inversión de manera
do
multianual y prospectiva,
adequate uh,
dialogar con el que define esas inversiones e
dialogue with the people that
identificar fuentes
define
de
this,
financiamiento adicionales.
identify
De ahí podemos
resources,
tener una
and
serie de
then we could
experiencias
have
que
a
luego va
series
a
of
depender de las
experiences
políticas
because that would
estrategias
depend
o
on
la
the
estructura
strategic
del Estado o
politics,
del
the
gobierno
structure
en
of the
cada país donde
government,
se
the
pueda
country where
trabajar.
actually we could
General,
work
digamos.
with.
Y luego una
But
buena práctica
a good
importante son los
practice in
comités,
this case would
que
be the
antes se llamaban
committees
comités de
because
disponibilidad
they were
asegurada de
called
insumos, ahora se llaman
availability
comités de
committees and
aseguramiento de
now
insumos, como le
they are
llamemos,
called
que
securing
son
committees.
comités que dan
So
seguimiento, y
this
eso es lo
provides a
definido en la
follow-up
política, en el financiamiento realmente se
for
ve,
whatever is defined in
¿verdad?
financing is
Y
something that
ahí
we're
un valor
compliant with.
agregado son las evidencias
And added
socioeconómicas, que es
value
lo
would
que
be the
mostramos para
socioeconomical
poder decir
evidence,
aquí hay
which is
que
something that we
invertir.
show and we say, okay,
Gracias.
we need to invest here, for example.
Acá otra pregunta.
Yes,
Existen
something that I would like to
postulados
mention.
en la salud
Some
mental
people
en el
have
trabajo de prevención del
mentioned
embarazo en adolescentes,
that
así
this is
como
something we
su
have
protección
contributed
del embarazo.
with. How do we increase this, or we have included
Por ahí,
this?
perdón.
Sí, si quiere puedo responder eso.
Yes, if you want, I
Creo
can
que de hecho
answer
ellos también me pueden
that.
apoyar con esto.
I'm
Nuevamente,
sure that
el adolescente y la
we're going to be able
adolescente
to
y
respond to that.
preadolescente son las
Adolescents actually
integrales. Es
are
una persona
integral beings, and
completa.
these are
Y sin
complete
lugar a duda, gracias
people. So there's
a
no
la
doubt
evidencia,
that
la salud mental es un
due to
componente
evidence,
fundamental
mental health
de una
is a
consulta de adolescente
fundamental
y de
right,
cualquier
actually.
consulta a la que
And
asiste el
any
adolescente.
consultation
Sabemos que la edad de la
that people will
adolescencia
go
está
to is also
asociado con el
important.
inicio de
We
las
know that this is
adicciones,
associated with the
los
start of
altísimo
addictions.
porcentaje de
We
accidentes de
have a
tránsito,
high
riesgo de
percentage of
suicidio,
accidents,
riesgo, o sea,
risk of
el momento de la
suicide.
adolescencia por su
So
propio
in
desarrollo
adolescence,
cognitivo
due
y
to their
cerebral,
own
realmente
cognitive
está asociado
development,
a
we know
que
that
el
this is
adolescente y
associated to
adolescente
the
tengan
fact
unas
that
conductas que sean
adolescents have
considerados de riesgo
conducts that
cuando
could be
realmente
considered
tienen que
as
ver con su
risks,
propia
when actually this
definición
is
de su
related to their
identidad.
own
Entonces,
definition
la
on their
salud
own
mental es sin
identity.
lugar a duda
So
fundamental en
mental
cualquier
health is
estrategia de abordaje de
fundamental
cualquier problema que querramos abordar
for
en la
any type of
adolescencia y
problem that we would like to
definitivamente la prevención
tackle.
del
And
embarazo
actually,
adolescente no es la excepción.
prevention
Por
is
ejemplo, en la
not
pandemia
exception.
hicieron,
For
se han hecho
example,
varios
in the
artículos en
pandemic,
la
we have
pandemia
seen
de cómo el
lots of
encierro
studies where
afectó
actually
la salud
lockdown
mental de nuestros
impacted
adolescentes y nuestras
mental health
adolescentes
of
y
our
cómo también
adolescents.
durante la pandemia
And
aumentó de
in
alguna
the
manera en muchos
pandemic,
casos el embarazo en
there
menores de 15
was
años por el
an
riesgo de
increase
convivir
in
con
people
su
that are
abusador durante
younger
muchos
than
años y el riesgo de estar expuesta a una mayor
12 years
exposición
because
de
they were
violencia de
exposed to a
género en el
greater
hogar. Entonces,
violence
la
within
salud
the
mental es fundamental
our
abordarla si
homes.
queremos
So
realmente
it is
hacer
fundamental
estrategias
to
de reducción del embarazo adolescente. Como yo les
respond
decía,
towards the
particularmente el riesgo de violencia de género y abuso sexual está allí y eso se aborda haciendo un
and we could
interrogatorio
tackle
que
this by
incorpore
responding,
depresión, ansiedad, trastornos alimentarios. A veces el trastorno alimentario se
and we could
diagnostica desde la
have
muchacha que puede menstruar, por ejemplo. Y, si no, y eso aparece en la historia ginecológica
we
de
have
adolescente. Y ahí entonces podemos identificar un trastorno alimentario. Es decir, la adolescente es una adolescente integral y un servicio diferenciado para adolescente en base a estándares
and
definitivamente
this is of
incorpora
course
la
based in
salud mental y debe
standards,
incorporar.
and it should actually incorporate this in a sense.
No tenemos. A ver, tengo otra pregunta.
We have some other questions.
¿Podrían señalarnos a si
I
existen
don't know if
buenas
you could
prácticas
mention
para
if
la prevención del
there's
segundo embarazo?
good practices when it comes preventing pregnancy.
Te dejo para que hables de la anticoncepción post-evento obstétrico que se nos ha
Yes,
Sí,
and
sí, eso
the
ahí le
contraceptive
dejo.
and
la tenía
obstetric
aquí en el
events, and this is
tintero.
something that was mentioned.
Casualmente acabamos de
Yes,
tener una
we
reunión
actually had a meeting
la semana pasada donde uno del
last week
grupo de trabajo regional de
where the
prevención del embarazo,
regional
¿verdad? Donde uno de los temas que abordamos es la anticoncepción inmediata post-evento obstétrico. En la región, en promedio, más del 90% de los nacimientos están sucediendo por personal calificado o en establecimientos de salud Sin embargo, en promedio, menos del 50% y hay países que menos del 5% egresa sin un método anticonceptivo moderno después del parto y los porcentajes también
So, for
son bajos
example, we could have
posteriormente.
percentages that could be
Entonces,
low and after the
hablamos
abortion.
muchas veces de que la interrupción del primer embarazo es, muchas veces la adolescente no fue al servicio o el servicio no se acercó por diferentes razones, pero cuando ya tuvo un primer embarazo, ya tuvo un contacto con los servicios de salud. Y el servicio de salud no debe soltar a esa adolescente. En ningún
So
caso
the
debe
health service
soltarla
should
apenas
not
cuando ya tuvo un primer
avoid
embarazo.
helping the
Pero
adolescent,
aquí debemos
particularly
de
when they
hacer
have a
un abordaje
first pregnancy.
integral.
So we need
Yo les
to
decía
have
que menos de la mitad vuelve a estudiar, pero esa adolescente debemos
a
promover
good
desde
answer
la
because we
protección
need
que
to
vuelva a
promote from
incorporarse al
prevention
sistema educativo
an
para que
incorporation
continúe
there.
su
And
desarrollo
this needs to
y
help
su
with
proyecto de vida lo pueda
their
llevar
project of
adelante.
life.
Y debemos ofrecerle las
And we need
herramientas para
to
prevenir un siguiente embarazo. Si no
include the
hacemos esa prevención en
prevention.
el
If
primer
we
año,
don't
en los
do
próximos
that,
2 años, más de la mitad de ella va a volver con un
almost
siguiente
half of
embarazo.
that is going to have a next
Pero también otra
pregnancy.
cosa que tenemos que
But
entender,
something that I
recordemos
would like to
que
respond to
existe
is
también el
that
embarazo en niñas menores
there
de 15
is
años y
pregnancy for
de eso
children
vamos a
below
hablar
15
también
years, and this needs to
desde el
have
punto de vista de
a different
protección,
tackling effect from the point of
porque
view
esta
of
legislación está asociada a violencia
prevention,
sexual.
because this could
Entonces
be
tenemos
associated
que
to
hacer
sexual
un
violence.
abordaje integral
We need to
de esa
have
adolescente,
integral
las
tackling
menores de
of these
15, las mayores de 15,
teenagers,
pero
but
particularmente las menores de 15 años. Es
particularly
muy,
the
muy
people that are
importante.
less than
¿Y cómo
15 years old.
establecemos esa
And this
ruta
is
de
largely important. We
atención
need
e
to establish
interconexión
an
entre los diferentes
attention
servicios, programas y
and
estrategias
interconnection.
que aseguren la captación
We
integral
need
de esa
to make sure
población de
that
adolescentes. Entonces,
we can capture
esto es
these
muy
people.
importante y
And
debemos
this is
promover
quite relevant
desde
because we
nuestros
need
servicios
to
la
promote
anticoncepción inmediata y
uh,
evento-obstétrica
contraceptives
en el marco de la elección libre e
when it
informada, con
comes to free
consejería desde la atención
decisions.
prenatal, con la posibilidad de elegir
And
qué
we need
método,
to
ojalá
decide
sea,
what are
en
the
la mayoría de los
methods.
casos, un método anticonceptivo de larga duración.
Maybe this could be a long duration aspect.
Gracias, Edgar. Y sí, realmente este tema es súper importante y a trabajar en ello. Bueno, tengo otra pregunta. ¿Cuáles son los principales retos para el abordaje del abuso sexual contra niñas y adolescentes en nuestra región? Estamos avanzando en la reducción de la
And we're moving forward on the reduction on that. So what are the strategies to tackle this? Oh, go ahead.
Bueno, si yo tuviera que decir una
Yes,
palabra
if I
en
have to
relación con
say
retos
one
para
word
abordar
when
el
it
abuso
comes to
sexual,
challenges to
creo que el
tackle
primer reto es el silencio
sexual aspects, I will
y
have to mention
de
silence.
alguna manera
For
la poca
example,
cuantificación
we don't
y
have
reporte y denuncia
quantification
de los casos de
reports
abuso sexual en nuestra
on
región.
sexual
Entonces,
abuse in our
cualquier
region.
estrategia
So
que vaya
any
dirigida
strategy that
a
could be
promover
directed
la
towards
denuncia del abuso, de alguna manera
promoting
promueve la protección
this, in
a
a
la
sense,
víctima
it
del abuso.
promotes promotion to the
Hay muchos,
victims.
una de cada tres mujeres en
There's
nuestra región en
like
algún momento de su
one of three
vida va a
women in
sufrir
a region is
algún tipo
going
de
to
violencia sexual
suffer
en el
some
curso de
type
su
of
vida.
violence
El número es
in their
realmente
life.
muy
So
amplio,
this is
pero
quite broad, I
aquí
will have to
también
say,
es importante
but
y lo
it's
que
important
trabajamos desde hace muchos
to
años, que
discuss,
es abordar
for
el tema
example,
del abuso sexual desde un enfoque
what's
interseccional,
the
porque no es
intersectional approach
solamente el
here?
abuso sexual como problema,
This is not
sino
only sexual
aquí
abuse as a problem, but
el tema
we
de la
have
ruralidad, el
the problem
tema
of
del enfoque
the rural
intercultural, el
aspect,
tema del
intercultural
enfoque
um,
asociado a desigualdades al
approach
ingreso,
focused
el
in
tema de ser
inequalities.
migrante
We could
o
have
persona en tránsito.
migrants of people that are in
Entonces,
transit.
abordar,
So
primero, evitar el
most of
silencio,
all,
promover la denuncia,
let's
pero después
discuss,
abordar el
for
abuso
example,
sexual desde un enfoque
tackling
interseccional, donde
from
claramente
a
hay unos grupos de
intersectional
población y
matter.
un grupo
So
de
we could
niñas
have
que están mucho más en
population of
riesgo
group of
de
women
sufrir
that
abuso
could be
sexual
in risk
y
of
que desde esa
suffering.
mirada hay que visibilizarlo.
this, and from this point of view, we could make it more visible.
Quería complementar, Gloria, algo que creo yo
Sigue,
también
sigue.
es muy importante. Sabes que debemos trabajar en el cambio de las
We
normas
need to
sociales.
work on
O sea, la
changing,
violencia, la unión temprana, el
for
embarazo adolescente no
example,
son normales.
adolescent
En ningún
pregnancy is not
sentido en
regular
ninguna
in no
cultura.
sense,
A veces se
in
justifica
because
por la
sometimes this is
cultura. Entonces la
justified in
violencia
culture and
es
violence. So
injustificable, la unión
this is
temprana, el embarazo
unjustifiable.
preadolescente. Entonces debemos tratar de desconstruir ese ideario social de que eso es algo socialmente permitido.
And this is
Para
something that
eso hay
is
que
socially
trabajarlo
allowed. So
de
we
manera
need to work
integral,
at this in
intensiva
an
y
integral
sostenible.
manner, in an intensive aspects as well, and
Gracias.
sustainable way.
Agradecemos las preguntas
Okay,
realizadas.
we would like to
Realmente
thank all
tenemos
the
como casi un
people.
par de horas
I think
responder todas las preguntas, lo cual nos es
we
imposible.
would love to
Pero
answer all questions,
coincidimos
but
en la
this is
urgencia de
completely
tenerla
impossible.
en cuenta para tener en cuenta
We
para
need
definir
to
algunos temas
consider
en el
this
próximo
because
webinar
we need
y
to
también
define
para
some
prepararlo
things in the
en el
webinars,
próximo
and we can
webinar.
incorporate
Valoramos la
this
participación e interés de
throughout the
todos
line
los
of our
que
work.
estuvieron
So we would like to
para cerrar este
include
espacio
or
de,
help all the people that are
espacio de
joining us,
preguntas,
and to close
nos
this,
gustaría mucho que en un
we would
minuto
love
cada uno de
that in a
ustedes, en el
minute,
mismo orden que lo mencionaron
maybe
Alejandra, Edgar y Carlos,
you, Alejandra, Edgar, and Carlos could give
como
us a
cierre de su
final
intervención.
message as
Adelante, por
closing your
favor.
interventions.
El embarazo
Well,
adolescente es un
teenage
problema de
pregnancy,
desarrollo marcado por profundas desigualdades. Son nuestras adolescentes pobres, rurales, indígenas, afrodescendientes, con
for example,
discapacidad,
people with
migrantes y
inequalities,
refugiadas,
migrants,
las que están en
refugees,
mayor
the
riesgo de
people
tener
that
un
have
embarazo
a
en la
lot of risks to
adolescencia.
have
Como bien se dijo,
um,
es un compromiso
problem
de
with
todos,
pregnancies. I
de
think
todos los
that there is a
actores
commitment
de
with
la
all of the
sociedad abordar
acting
este tema.
people in
Ministerio de
the
Educación,
society
Ministerio de Salud,
to tackle
Ministerio de
this
Protección,
aspect. The
Ministerio
Ministry
de
of
Trabajo,
Health,
Ministerio de la Mujer,
the
Ministerio del Deporte.
Ministry of
Y es un
Women and
compromiso también del
Sports.
sector privado, de las organizaciones
It's
no
a
gubernamentales, de las organizaciones de la sociedad civil y, por supuesto, con la participación de la sujeta de derecho, de
And
la
this is
adolescente.
subject
Es
to
solo con el
rights
compromiso de
of
todos nosotros
adolescents, and
podremos
only with
abordar esta
the involvement
problemática
with
y
other people
dejar
we
de
could
ser
tackle
la
this
segunda región
and
con
be
mayor
the
embarazo
region
adolescente en el mundo.
of less
Gracias, Edgar.
pregnancy in the
Bueno, yo
world.
complementaría diciendo que necesitamos
Yes,
priorizar el
and
embarazo
I would
adolescente,
like
la
to mention that
prevención
we
del
will need to
embarazo adolescente
prioritize
al más alto
prevention
nivel político
in a highest
para
political
abordar sus
aspect in
determinantes
order
con
to
tanto
tackle
políticas, planes, estrategias,
the
con
this. We
indicadores,
need to have
metas y
plans,
presupuesto
policies, goals,
acorde a las
budget
necesidades.
according to the needs,
Debemos
and we need
avanzar en la
to move
implementación de
forward in
estrategias basadas en
implementing
evidencia,
strategies
porque
based
muchas
on
veces
evidence,
estamos implementando
because many
estrategias
times
que no
we're
han ya demostrado en
implementing
laboratorio que
strategies
funcionan o que tienen
that
impacto, y ya
could
sabemos
have
claramente, y aquí
an
se ha
impact as
comentado,
well.
qué es lo que tiene
So
impacto
we need to
en la reducción de
mention what
embarazo
could
adolescente.
impact on
Eso implica que
the
tenemos que sumar los esfuerzos de todos y todas para
teenage pregnancy
acelerar
reduction. So
la
we need
reducción del
to
embarazo adolescente de
accelerate
manera que se
teenage
reduzcan
adolescent
también las
pregnancies
brechas de
that
desigualdad.
could reduce
Eso es
this
muy
inequality.
importante
So
para llegar, como decía Alejandra, a las que están, que, las personas que están
we could reach
quedándose
people
más atrás.
that could be
Entonces, esta es
left
una
behind.
responsabilidad de todos y todas.
Muchas gracias, Carlos.
Gracias, Gloria. Tengo que confesar que durante la sesión he transitado por la idea de, bueno, ¿dónde estuve yo como adolescente, no? Porque no fue que nací
So
de
I would
18,
like to
de
mention
18
where
años,
we
sino
are
que
as
fui adolescente.
adolescents.
Y la
I was an
pregunta es,
adolescent
bueno,
once,
qué fue? Porque yo sí tuve opciones y
and I have
oportunidades.
had
Y cuando yo
options and
digo que
opportunities.
lo que
So
yo tuve fue
I
es un
was,
privilegio en
I
comparación a
asked
otros
myself,
adolescentes. Eso
why
además
should
es
I
muy
feel that this
difícil.
is something
Cuando
that
me pongo en esa posición,
involves
yo digo, bueno,
adolescence? So
¿qué me falta hacer?
sometimes I think, what do I need to do? For
Según
example, from my
cómo
humble
puedo contribuir.
tribune,
Una
how
vez
can I
busco esas
contribute?
preguntas,
And
porque
once I find
justamente,
these
y Alejandra y
questions,
Edgar
Alejandra and Edgar mentioned this as
abordan
well.
estas preguntas,
I hear that
creo que nos urge
we
romper los límites de estas
need to
conversaciones y
break
asegurar que no siempre seamos los
the
conversadores
conversation.
centrales de lo importante que es este tema.
And
Además
because
que necesitamos
some people do not only consider these problems. We need to transfer our Ministry of Health, the Ministry of Economies, the presidents of the banks, because investing in adolescent is investing in the sustainable development of our countries. And this shouldn't be something that we should try to convince people. We need to add some whales. So from then, I would like you to invite this as a challenge. We need to break the boundaries of our conversations, and we need to reach audience to add this type of initiatives. Thank you. Thanks to all the participants and everybody that is joining us week after week in all of the webinars that we are currently performing. So thanks to Horas Konu team that are supporting this event to reach all of the people that are in the audience. So I would like to thank all the people that are responding to us, and organization and privates and publics and organizations. And I would like to have people from Argentina, Bolivia, Argentina, Colombia, Panama, Bolivia, Cuba, Ecuador, Paraguay, Colombia, and Venezuela. Thank you for always being with us and supporting us. This event has been possible thanks to the commitment with integration in Latin America. So just to continue, we are going to give the go ahead to Dr. Mari Carmen. Thank you.
Gracias. Bueno, mis primeras palabras son de
Well, I would
agradecimiento.
like to
Gracias,
just
gracias Alejandra,
thanks
gracias Edgar, gracias Carlos por habernos dado su tiempo. Creo
Alejandra,
que el tiempo
Carlos,
nos ha
Edgar, for
sido
giving your
valioso
time. I think
y
your
nos ha
time is quite
inspirado
valuable, and you have
nuevas
brought
miradas.
us a new
Como una
look.
vieja en el tema,
Um,
porque esto del
since I'm a bit
sexo
old
adolescente lo vengo
in this
viendo
topic, and I
ya
have been
perdido por los
discussing
años, creo que son
this for a
casi
long time. I think it's
décadas que lo
almost
perdí.
3 or 4 decades that
Solamente
I
les
have
quería
been working in
compartir.
this, but I
A mí
just
me
wanted to
gustan mucho las
mention
historias,
that
¿no?
I love stories.
Cuando yo tenía
So
20 años,
once when I was
durante
20
mi
years
medicina,
old
yo
and I was a
estaba
medicine
loca por ir a
student, I was
tener un
crazy because I
parto. No me
wanted
tocaba todavía.
to
Me tocaba
to
después.
deliver a
Yo
baby.
quería
It
tener
was
un
not
parto.
my time yet, but I
Entonces
wanted
me fui
to
con mi queridísimo
deliver a
esposo.
baby
En
for.
esa época ya éramos enamorados.
So in my
Y nos
time,
fuimos a tener un parto en
I
la
had my husband with
maternidad
me,
del
and we
Ministerio
were
de
and
Salud
we
del
delivered a baby,
Instituto
both of
Nacional de
us.
Salud
But now this is the
del
National Health
Estado de
Institute,
Y llego pues súper
and we
emocionada,
got
nunca había
there,
visto un
and
parto, ¿no?
I've never seen a
Y
baby born
termino
before, so
viendo un parto
I ended up
de una chica
watching
de
baby being
19
delivered
años. Yo
of a
tenía
19-year-old
20, ella
girl, and
tenía
I was
21.
20 around that time, almost
Era
21.
su
And
séptimo embarazo.
it was her
3
seventh
bebés,
pregnancy. She already had 3 babies,
aborto. Este me iba a
and
ser
4
4.
abortions. This
Y
fourth
solo
baby
tenía
was gonna be
19
her
años.
fourth child, and she
Realmente
was only
a mí me marcó tanto eso, Alejandra. Me marcó, ¿no? Yo vi y dije, esto no puede ser, ¿no? Esto es imposible. ¿Cómo es que yo tenga todo y ella esté en 19 años con 4 hijos? Entonces, ahí comencé a pensar que, como muy bien lo han dicho y lo repetimos siempre, este es un tema, este no es un tema solo, esto no es solo un problema de salud pública, va mucho más allá. Es desarrollo, es derechos humanos, es desigualdades, ¿no? Y me han encantado estas nuevas miradas, ¿no? Primero que todo, cuidado, el tema se vuelve terrible a los 14 años. No teníamos ese dato. El dato que siempre tenemos es que entre 15 y 19, sí o no, Alejandra, se dispara en 18 y 19. Pero cuidado, entre 10 y 14 ya se disparó a los 14 años. ¿Ok? Y ahí hay un mundo de diferencia. Los que somos médicos sabemos que 15 años es el límite para todo lo que es físico, ¿no?
We
Pero
know that
sabemos
15
muy
years is
bien que
the
todo lo que es mental, emocional, todavía se soluciona
limit
después.
for asking
Entonces,
things.
yo
And
creo que
we
este
know
dato es
that
importantísimo.
this data
Y yo
is
digo de verdad
important.
que ya lo sabemos,
Um,
ahora está mucho
and we
mejor,
know
pero
that this is
estamos hablando de invertir
way
en adolescentes hace
back,
años,
and we were
años.
trying to invest on
Pero
adolescents
como
for
lo ha presentado
years.
Edgar, no,
And as Edgar
me ha gustado mucho.
represented,
¿Por
is
qué?
something that I liked a
Porque nos ha
lot.
dicho el impacto en
And
las
we
áreas
have
y todo en
seen the
cuanto,
impact
¿no?
in the
Y estamos hablando
areas,
del
right?
retorno, ¿no, Edgar? Y te ha sido de 15 a 40 dólares por cada dólar.
And we have
Bueno, tú sabes que
seen
tú eres especialista
reflections
en
per each
economía y tú
dollar.
sabes que eso es lo que les interesa a los
We
decisores de
need
alto
to
nivel.
have,
A los de arriba es cuánto va a ver, ¿no? Entonces, yo creo que ese es un tema súper importante.
I think that this is
Y el
something
otro
that is
tema que
way
no he
important
sacado
and something that was
mucho,
removed
pero
and
tengo que de
was
verdad, pero me
launched.
gusta porque
And I
conversa
think
lo que
that this is
queremos
something that
hacer,
you mentioned
es
once
el
again and
punto
again,
C,
is that
solos no podemos.
we cannot
Tenemos
do
que
it on our
juntos,
own.
para eso una
So we
iniciativa,
need to
cero
have
embarazo
initiatives. We need
que
to have a
digamos,
zero
no sé si
pregnancy
llegaremos a
initiative.
cero,
I
pero
don't know if we're gonna reach
hay que
that,
tenerlo,
but
deber
we
serlo, hay
need
que
to
tener, hay
have
que poner una
the
visión súper
will of
alta, ¿no?
wanting that.
Y otro tema que
And
también han
another
sacado, me
topic
pareció
that
súper
was launched, and I
interesante,
think
el
that is
tema
quite
extracurricular.
interesting, is the
Y
second
para eso tengo
pregnancy. And I think that
anticoncepción,
we
no,
have
ayepo, creo, ¿no? ¿Cómo es? Anticoncepción,
we have
post,
Inmediata
contraceptives.
post-evento obstétrico.
no, no, todavía no
I
la,
still
Eso
don't
no la
have
digo,
a right name
pero
for
bueno,
that. Okay,
post
so but
evento
it's
obstétrico.
post
No hay
obstetric
ninguna
event.
limitación. Y a
There's no
eso,
limit in this
aunado
case.
del tema que
And
estamos
if we
haciendo del
continue and include
postnatal de larga duración,
the long duration
pero que no lo
contraceptives,
saben nuestros
but
profesionales.
I mean,
Nuestros
many
profesionales están
people in the
seguros de
profession
ello.
don't know
Nuestros
this, right? We have
profesionales
people
están,
that
no, si es
have
adolescente, ¿cómo le vas a
myths.
poner guardia?
Sometimes they
No,
say if
si
this
estoy
is
acá,
adolescent,
no,
how you're gonna
me
include
dejo
this? So
entender. Hay mucho
there's lots
desconocimiento, mucha
of
creencia
myths,
que va de la
and
mano de la
this
no
is related to
actualización.
lacking
Porque una
an update
obligación del profesional de salud
because
y
the obligation
especialmente el
from the
médico es
health
estar al día, pues,
doctor
¿no?
is to
Tenemos que estar
be.
actualizados. Yo no puedo seguir recetando para la infección respiratoria algo que hace 40 años me
I
enseñaron,
mean,
¿no?
I cannot
Me
use
dejo entender.
something from breathing
Y lo
from
último
ins-
es
respiratory infections, something that I
adolescentes,
was taught
¿no?
about
Vamos a
years
hablar
ago.
por
So
adolescentes.
there's no
Y la
only way to
anticoncepción
be an
ayudable,
adolescent. So
importantísimo.
working as cross
Pero
section
no nos
is
olvidemos
important. So let's
de
not
los
forget
cordones
that we
alrededor de las
have,
ciudades. Siempre
for
hacemos
example,
diferencia entre
peripheral
los
areas
urbanos y
around
los
the
rurales.
cities.
Nadie habla, o lo hablamos muy poco,
Nobody
de lo
talks
urbano mágico.
about the
Y
marginal
yo no
areas.
necesito
And I would
irme
like
a
to
Puno, a
mention
la
that I
zona
don't
más
need to go
pobre,
to Puno.
sino si puedo irme a Ticlio Chico acá, que solamente es arriba, y también tengo esos indicadores. Entonces, no nos olvidemos de ellos, ¿no? Y por último, porque si no voy a seguir hablando y no se va a acabar esto, y por último, no nos olvidemos de los hombres. En los embarazos tiene que haber un hombre. Bueno, ahora ya no tanto, pero bueno, no, sí tiene que haber un hombre. De todas maneras,
So
tiene que haber, ¿no? Hay mil formas ahora de embarazarse.
there's a
¿Y
lot
qué
of ways
está
of getting
sucediendo? Y eso lo
pregnant,
estamos
but
viendo
what's
ahorita.
happening now? And this is something
Cada
that we're
día
seeing.
tenemos más
Every day
padres
we are
adolescentes.
having
Cuando
adolescent
tú ves ustedes
parents.
ven los
And if
números de
we see,
Perú, lo
for
vemos ahora en
example,
Brasil,
numbers in Peru,
50% son
it's
mujeres
crazy
embarazadas.
because
No estamos
50%
hablando de poca gente, estamos hablando de un
is
montón.
a
Entonces,
lot.
¿qué nos está diciendo
So
eso?
what is
Estamos haciendo las
happening with
cosas
us?
mal
We're
con
not
los
doing our
varones.
things right.
Este tema de
With men
masculinidades,
also, the
y acá también,
masculinities.
yo he tenido la experiencia hace 10 años fabulosa con Ucayali, con Callao,
I
con
have
nuestro grupo de
great
jóvenes
experiences with
que
Ucayali, with
somos
Callao, with our
nada
groups of
sin
people
ellos,
that were
¿no?
mentioned,
Todo por ellos, para
and
ellos y con ellos, definitivamente.
and
Pero
definitely
no nos olvidemos de
we
los
should not forget
varones.
about boys
¿Por
as
qué?
well,
Porque estamos en un momento
because
distinto.
this is a different time.
Nunca han habido 5
And never
generaciones
has
juntas
there been
acá
5 generations together. This is the first time in the world that we have 5 generations. So we need to talk to, for example, Carlos, that is 38, and I am 68, and my grandchild is 11, and life is completely different. So we definitely need to be based on evidence, but we also need to do evidence. We cannot have studies, and as Latin America and the Caribbean, we are missing a lot.
Esa es la verdad. Nosotros comenzamos a
So
investigar
we
esto,
need
¿no,
to
Gloria?
investigate from the parents, the girls from 10 to 14 years, and we started moving along. Once we reached the hospitals, we were blocked. So sometimes they don't let you talk because there's people that are a bit violent in this case. And I would like to appreciate the invitation from Alejandra because she invited me to come to Cartagena. And I was thinking what we could do because we have not improved. And there was lots of violence. This is related not always to pregnancy in girls from 10 to 14 years old. So I would like to thank you for all of the work. We are completing the Andean politics for preventing pregnancies in adolescents with your support with UPFA, and we are now finishing, and we are on the implementation. But if we do not consider children and adolescents as the present and the future, we are not talking about progress. So let's remember that by each action that we would like to do now, all our actions need to be related to the future. So let's not wait to discuss this afterwards, and let's start looking on the convention. So we need children that are educated, that are protected, and that have rights. And what adolescent wants, and this was in the Oxford Review, they only want three things. They want a safe environment, and this is something that they don't have, a protection for them, and what's most important, an equitable environment. If I have the same rights as other people, I need to reach where my potential helps me reach. So thank you. Excellent webinar. I think we have had more than 200 people. You have not entered Facebook, and on Facebook we have people as well. It was almost 300 people. We have 350 people. 350 people, thank you. And remember that all of this will be published in horaspoint.org. You can enter YouTube or Facebook, and I'm sure that that's gonna be seen because there was lots of interesting aspects. So we would like to wait in the next webinar. The webinar that we just had is webinar 245. We started in May with this. And now we're going to go to the next webinar. The next webinar is going to be on Tuesday, October the 3rd. And the topic would be growing old, because on the 1st is the International Day of Old People or Older People. Okay. We would like to say that these are older people involved. Thank you. Bye-bye. And thank you for all the Orozcono, particularly Gloria and Yadira and all the people. Milagros. Always forget about Milagros, Rob, Marisela, all the people from Orascono. Thank you. Bye bye.